and are willing to take, we recommend the vaccination. But today, we focus once again on empowering everyone to know what to do at home should they have COVID. And certainly, COVID does not gravitate or does not mutate or does not end up with you severe from day one. It's a process. So we are trying to engage the population here and abroad earlier in the process of the disease. I am pleased and humbled to be able to co-chair this meeting and recognize there is a great desire for us all to learn more as we share our experiences. So to get things started, I'm going to hand you back over to our hosts, announcers for the evening, which will be Tony K and Faithlin. So over to Tony K, and good evening and welcome again, everyone.
All right, good evening, everybody. So, as was mentioned, my name is TK Dawkins. I am going to be taking you smoothly and seamlessly through tonight's very informative session. And, let me just tell you that I actually came and attended this last week, and I was so blown away by the work that's being done, by the information that was given. And so when I was asked to be the MC for this week, or the moderator for this week, I was so excited because I know that there's great work being done. It's interesting that Dr. Hunter handed over to me because I'm about to hand it right back over to him. But before we do that, I just want to have a warm, hearty welcome to everyone who has logged in, everyone from the Medical Association of Jamaica, the Nurses Association of Jamaica, the AGP. If you're a part of the media, I know that we have presidents, we have Rotary clubs, Kiwanis clubs, we have a lot of people who are logged on, and we really, really appreciate you spending this time with us to really educate yourself on what you need. So if you're Jamaican, big up. If you're from the Caribbean, hello there. If you're international, welcome, welcome, and a special welcome to anyone who is currently logged on who is COVID positive. A special welcome to you. We are so glad that you are here to get some more information on what it is that you are overcoming at this time. All right. So I am actually going to hand over for the welcome and for the opening remarks. The person who has really been instrumental in putting together these informational sessions. I also have to give a great thanks to Medical Strategies, who's the sponsor of this informational session that has been running week after week after week, educating literally thousands and thousands of people. And so Dr. Roger Hunter, who has been a champion for, really helping getting people to overcome this, I bring him back. I thank him. I thank everybody who's a part of this process, as well as Medical Strategies that was really, really instrumental in helping to make this a reality. So, Dr. Roger Hunter, I invite you back to do the official welcome and opening remarks.
Thank you, Tony K, and thank you everyone who have joined us tonight. It is an honor to have you all. And again, special welcome for all those who are battling COVID as we speak. It is very much humbling that you have been able, through treatment, through early intervention, that you have been able to come tonight and to share tonight and to empower so that we can overcome COVID by intervening early. To get things off, we cannot do anything without God's guidance and inspiration. And as usual, we will ask for spiritual guidance. And tonight we're especially blessed and humbled to have the Reverend Adonier Jones to lead us off with a word of prayer. Over to you, Reverend Jones.
All right, good evening, Jamaica and Jamaican in the diaspora and people everywhere joining us. I humbly accept this important duty to share in this most constructive conversation and engagement toward making our Jamaican nation and society a more healthy one, and to provide the best holistic response in the deepening COVID-19 pandemic experience that we have been going through and at this very troubled spot in our nation. I want to commend Dr. Roger Hunter and his team for this pro bono contribution to the nation. And we invite all of us this evening to prayerfully participate, thinking about the sanctity of life and our social responsibility to one another in fighting the virus. May I invite you to pray with me, please. God is our refuge and strength, our present help in trouble. Our Father, we come at this time in our nation when many are at a breaking point, when we are grappling with this most severe virus. We come seeking your help, desiring to learn to live wisely. We open our hearts and our minds this evening in this conversation to learn more about the virus, about early home-based treatment, early home-based intervention. And Lord, even again to publicly embrace that the vaccine and taking the vaccine is a part of the solution to the crisis in which we have found ourselves. We pray to be guided by your grace. We pray to be blessed by your wisdom, and that the evening's deliberations will be instructive, taking all of us to a greater place where we can care for self and care for one another and join in the collective fight against this virus that is so ravaging. So we commend, Lord, this medical team into your care. We affirm, Lord, that they have vowed to the sanctity of life, to a sacred responsibility to care and to share information that will help in solving our problem. And so we pray that all of us will listen well and actively and respond with our best heart and minds attuned to what is being said. We pray for you to help Jamaica, land we love, Lord Jesus, and help all of us because we are all stakeholders in this situation and in this struggle. So bless our meeting and lead us, Lord, through your instruments. For we pray with thanksgiving through the name of Jesus Christ, our Lord. Amen. I hand back to you, Dr. Hunter.
Amen.
Bless you.
Thank you, Reverend Jones. Reverend Jones is the leader of the Church of God in Jamaica. And we are pleased and humbled again to have you here. Thank you, Reverend Jones, and we will call upon you again for spiritual guidance. So as we get into our meeting, we have an exciting list of presenters tonight. And for the first time, we'll have Dr. Arlene Jones, our first speaker. Arlene is a very well respected and experienced physician who has always practiced holistic medicine integrated with Western medicine. We believe the time is apt to see how Arlene's experience gradually interfacing between Western modern medicine and traditional Eastern medicine, how that can help us in this pandemic. Arlene's experiences covers medicine in Japan and in Europe, and also locally with our herbal ethnic medicines and herbs. Arlene is also a dermatologist as well as a integrative family practitioner. So we welcome Dr. Arlene Jones, and it's certainly a pleasure to have you here. So without further ado, I'd like to hand you over to Dr. Arlene Jones. Arlene?
Hi, Roger. How are you doing, Dr. Hunter?
Very good. Thank you.
Just reminding you, my name is Dr. Arlene Rose.
Thank you.
You call me Dr. Jones.
I know why.
Can you make me co-host so that I can share?
Absolutely.
Okay. In the meantime, thank you. In the meantime, I'll just say it's a pleasure to be here. Looking forward to bringing us to, a new dimension in the conversation in our fight against COVID. So I wanted to just jump right in because my time is going to be limited based on the time that we have. I had a look at some tactical strategies during wartime. And if we consider our enemy, which is the SARS-CoV-2 virus, as these units in red, and our strategic plans as these arrows in blue, we could say that over the past 2 years, we have been employing one major strategy, which has been coming against the spike protein. Now, in war, you can't just literally send foot troops in. You have to attack it from you have to attack your enemy from many different dimensions. And I have to congratulate Dr. Hunter for bringing a new dimension in the form of early home-based treatments to the conversation. But today, I'm going to bring the conversation to a different realm of discussion by introducing some of the natural therapies that Jamaicans have been using against COVID, and not only Jamaicans, but people around the world. And I'm introducing it because many of the things I'm going to share are actually natural immunity boosters and, will be of some use and have been of use to patients in Jamaica. And so without further ado, I'm going to start with a disclaimer, first of all, that this information is not a substitute for professional medical advice, diagnosis, and treatment. Are you seeing my screen?
Not as yet.
Okay, let me.
Sure.
Can you see it now?
Definitely. Go ahead. Thank you, Dr.
Okay.
Rose. Thank you.
All right. So this information is not a substitute for professional medical advice, diagnosis, and treatment. It's not intended to discredit any current medical or governmental protocols, and it's not intended to discredit the great work done by our doctors and nurses in our hospitals. So moving on, this information is going to be useful. I find it personally useful because there are times when I will get a call. I don't know about others of us working in this fight, but you get a call from someone saying that, oh, my uncle my uncle is having having difficulty breathing now, or my aunt or my sister or whatever is having a challenge breathing, or they're not feeling well. They've been diagnosed with COVID and they're at home alone. Can you call them and help them? And the thing is, pharmacies may be closed. There may be absolutely no way for them to get any of the early home-based treatments that we like to prescribe. And you have to find a way to help them quickly. So usually the first question I ask is, can you get to your kitchen? And if they can't get to the kitchen, then we can start somewhere. So I'm going to share an incident that happened. There is a nurse, a Jamaican nurse who shared with me in conversation that she works in a COVID unit overseas, COVID ward, and got tired of seeing patients die. And so she decided, knowing what she knows about Jamaican herbs, to actually prepare a mixture of Jamaican herbs and give them to the patients. And she and a fellow colleague did just that. And what happened was that everyone on the ward got well and walked off. Right, so everyone on the ward got better and left the ward. So I can't say that I endorse her actions, not at all. I don't endorse what she did, but I have to admit I was intrigued by the fact that Jamaican herbs clean up the ward. And so I had to know the ingredients. And her first ingredient was garlic. And in doing my research with garlic and its effect on the SARS-CoV-2 virus, what I discovered was that it inhibits the multiplication of the virus. It blocks viral attachment. It causes holes or damage to the fatty envelope of the virus to which the spike proteins are attached. It has an anti-inflammatory and immunomodulatory effect as well. And it is a broad spectrum antimicrobial. Now, if we look back at our home-based management recommended by Dr. Hunter, which includes the ivermectin, which includes a steroid such as dexamethasone, which is our immunomodulator, which includes antihistamines, which includes antibiotics in case of secondary infection, which includes anticoagulation. You'll find that a lot of these qualities are actually represented here among our Jamaican herbs. So garlic has these qualities. Who knew? I was surprised to see that there were actually studies on this in SARS-CoV-2. Ginger was the second herb, and this inhibits the spike proteins in the virus. It also blocks the ACE receptors, which therefore enable less binding of the spike proteins of the virus to the host. There's also a broad spectrum antibacterial effect as well, and it's a natural anticoagulant. Turmeric has received a lot of interest and attention recently. It was discussed in an article in the Gleaner recently where one of our major hospitals is using turmeric tea to help improve the outcomes in patients. And when I researched turmeric, what I found is that it prevents binding of the viral spike protein to the ACE receptors in the host, right? And it causes disruption of the viral envelope. It induces host antiviral response, and it helps prevent lethal pneumonia and the acute respiratory distress syndrome. And onions are the next ingredient. Now, onions blew me away. When I started to research onions, I realized that there is so much more to onions. And what onions do in SARS-CoV-2 is inhibit spike protein attachment. It has immunomodulatory effects, anti-inflammatory effects, mucolytic action. It's an anticoagulant, an expectorant, and a general antimicrobial. And it even crosses the blood-brain barrier. It's cardioprotective as well, which is good because there is a tendency towards myocarditis in patients who have COVID. It's an antipyretic as well, which means it will have some benefit in the early stages of COVID. and it also protects the body from damage as an antioxidant. There are many, 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 many more benefits of onions that I really could not, you know, I could spend a whole talk talking about onions. And what intrigues me the most is that when I tell patients to go to their fridge, if that's all they can do and everywhere is closed, and they make themselves onion tea, every single one of them comes back to me and says, boy, doc, that was the bomb. Yes, I feel so much better. The improvement is just notable in all patients. So I really can't say enough about onions here. Some patients choose to put them on their feet. Some patients tell me that they put it on their feet and they wrap it into place with saran wrap and put socks on. Some patients say that they put the onions on their chest and they wrap it in, hold it in place as well. And in both cases, it works. It works. Those who put it on their feet say they're actually tasting the onions. They can taste the onions after a few minutes. So for some reason, it absorbs and does what it needs to do. And this is basically anecdotal, but studies are showing that the benefits are noted by persons in other countries as well. I have to also mention cayenne, which is interesting. It's a very interesting component because it protects the cardiovascular system, but it also prevents clotting and has this sort of adaptogenic effect where it also prevents bleeding as well. So if a patient is taking many herbs together, which all have anticoagulant effects, this herb can offer a little bit of assistance in preventing bleeding, which is always a risk when your patient is not able to go to the lab a lot. I keep seeing a message saying that Faithlyn Williams is requesting remote control of my screen. Should I allow it, Dr. Hunter?
Yes, Arlene, it's just to click on that to make you into presentation mode. You know, there's a little, what should I say?
I allowed her.
Make it right to enlarge it. Right here, I think.
All right.
Right at the bottom here, it's where the arrow is.
So you want me to enlarge it?
Yes, right there. Yeah, to make it into presentation mode. Go to the.
Okay, whoever just gave control of the screen can probably do that. Is that better?
No, it's a little cup beside the book, or just go.
Okay, Doc, let me assist her.
Thank you.
Okay, Dr. Rose, go
Yes.
to where you see slideshow at the top in the taskbar, over, a little bit more over. Right, click on that.
Okay, I see it, but there's a reason I didn't want to do it, but I can do it. If it would make it better.
Persons are requesting it. The second one from current slide there.
Okay. Is that better for everyone?
Yes,
it is.
Okay. All right. So cayenne has this effect where it can prevent bleeding or it can prevent clotting. So that's kind of beneficial, very useful. It's antibacterial and mucolytic. It's thermogenic, which means that it increases the temperature of the body of the person who is taking it or using it, and it dilates the airways. Now, one of the things that I did not know about cayenne is that it is used in mast cell mediated conditions, which means that it can help with this kind of allergic anaphylactic tendency, which Dr. Sankara Chetty from South Africa described it when he explained the different phases of COVID. I mean, his talks have really opened my eyes about a lot of things and helped me greatly in terms of how I manage COVID patients, because you do have that initial phase where patients are having typical flu-like symptoms, or they're having issues like vomiting, gastrointestinal issues. And then you have the second phase, which acts like a severe allergy with the cytokine storm, etc. And so it's managed similarly with the steroids and with an antihistamine. But mast cell mediation can actually help in conditions which have anaphylaxis or allergic components. And so I found this useful as well. Going to the next slide. All right, honey and lemons, I didn't really go deeply into because that's well known. We actually have over-the-counter cough medicines that have honey and lime in it as their main active ingredients. So I think we know a lot about that. Honey especially is antimicrobial and broad spectrum antimicrobial and anti-inflammatory as well. And it also reduces irritation. Lemons and limes are useful in that even though they are acidic, they alkalinize the body. And if we look at viruses in general, there are a couple of things that are their Achilles heels. One of which is the fact that they do not do well in strongly alkaline conditions. So anything that alkalinizes the body will actually strengthen or improve the body's ability to combat a viral illness. Now, virgin coconut oil contains lauric acid and monolaurin. These are well known in combating different forms of RNA virus, including HIV. A lot of work has been done in the Philippines regarding viruses with fatty envelopes, and it has been found that virgin coconut oil and its components disintegrate, absolutely demolish and destroy the fatty envelope of viruses. Now, the spike proteins are, as I said before, a part of the fatty envelopes of SARS-CoV-2, and therefore, you know, just having someone, I can give you an anecdotal report. I've had patients who are taking virgin coconut oil. I won't tell you where they got it, but they're taking it, and what happens when they take it is that people around them will get sick, but they just will not. They've had people around them, like their entire family will be sick, but they just don't get it. And so that's something to take note of, even though it is anecdotal. But I've seen it enough that it's, you know, it really is striking to me. It also has been known to reduce the infectivity of viruses by up to 99%, and that's many different varieties of influenza type viruses. It is antibacterial as well and has immunomodulatory benefits. I also want to make a special note that if we have Jamaican patients and you are using the home-based remedies that we've been discussing for weeks, you may want to consider making an adjustment to the type of anticoagulant that you're using if a patient is also using onions or also using any of these herbs as teas, which have anticoagulation properties. So we want to exercise caution there. And now we're going to talk about something we've been hearing about for a long time, Dr. Hunter's favorite thing to talk about, and it is steam inhalation. Now, one of the Achilles heels of all viruses is that they are denatured by heat. And if you just think about washing a pot with fat on it, if you use hot water to wash that pot, you're gonna be more likely to get the grease off of that pot. So because the fatty envelope is made of fat, it is destroyed by heat and irreparably to the point in which it cannot bind anymore. Once the temperature is sustained for long enough, you can significantly reduce the amount of viruses in the nasopharynx. And I found studies on that, including one of note in the Journal of Biosafety and Biosecurity, done in June 2021. For those of you who need the journals that who want the sources of my information, there's a separate PowerPoint that I can send, which has them all. You can ask Dr. Hunter and I'll make sure to have it available for him. Okay, so steam, basically, when steam forms, it forms at 100 degrees, right? Now, we cannot have that in our nasopharynx, clearly. So what patients are doing, they're using a towel and covering the source of the steam and letting it come up as hot as they can tolerate it. They open their mouths so that it can go into the oropharynx as well and close their eyes. And that's how they do it. Generally, steam, I haven't tested
Recording
it.
in progress.
I haven't tested it, but I recognize that as steam is formed, it is absolutely going to be cooling. So it is a good idea to steam for a longer period of time. Obviously, hotter temperatures require less time, but once steam begins to condense, then you are going to need longer time. So as hot as you can tolerate it for at least 30 minutes is the recommendation. And I endorse that recommendation. 2 to 3 times a day. Menthol can be added to it, so can eucalyptus oil and a cup of peppermint oil as well. Generally, a note on menthol is that the crystals prevent binding of the spike protein to the ACE receptors in the nasopharynx. A lot of work has been done by Dr. Daniel Ogunsalo, and we've been reading about that in the Gleaner, or local newspaper. It's been quoted in many international studies as well. So these are the oils that persons use to steam with. There's actually a doctor that I know of who is using nebulized sodium bicarbonate, and that exploits the propensity of viruses to be destroyed at pH of 8. I've also seen where patients on ventilators have had significant improvement with nebulized baking soda. This I included because this is the position that allows patients to breathe with greatest ease based on what I'm learning from my patients. There's so much you can learn from patients. All right. And I hope you've enjoyed this talk. Lots of food for thought. And let us continue to be the COVID champions that we are in this fight against our common enemy. Thank you all for listening. Okay.
Thank you, Arlene. That's really a breath of fresh air. I've been monitoring the chat, and I think you have lit up the chat with all these amazing remedies. People are totally logged on to this. Arlene, do you care to share a contact, like an email or an office address, because people are reaching out for you separately? I mean, I'm happy to be the vehicle for contact, but how have you found this, using this combination of naturopathic line of medicine integrating with your traditional medicine? I mean, Arlene was my classmate from medical school, so I certainly apologize for joining your surname with Reverend Adinair Jones, who is a church overseer for the Church of God. But I mean, I've known Arlene for over 30 years, and it's been an enduring friendship, and you couldn't tell by looking on her. But yes, Arlene, can you tell me just how important it is to integrate this naturopathic medicine that patients already would have started in a lot of times by the time they come to you, and getting them to accept like traditional medicine? Just say a few words on that.
Okay. Basically, how all of my interest in this began is there was a time when I myself was sick, and doctors were, not able to come up with a diagnosis. They did have treatments, and I had to find a way to help myself. And so I discovered that what we learned in medical school is just a part of the story. And so, in regaining my health, I learned a lot, and that piqued my interest. Since then, I've been using different modalities of treatment, innovations in medicine to help people to get better. And especially in cases where doctors are stumped or where the medications are not working and so on. Using herbal medicine is something that we should not ignore, because we have to remember that most of our current medications are made based on herbal remedies themselves. So it's just that they're remade in a lab, or they extract a particular component and give it a name and add chemicals to stabilize them. So we definitely cannot ignore the herbal remedies. Another thing I notice about them is that they work synergistically. When I heard that nurse share her story, I was a bit horrified, because the drugs are all used in combination. The herbs were all used in combination, and it was quite a number of them. So I wondered if, maybe patients would have bled or, I would have wondered, but if you think about it, a Sunday dinner may just contain the same amount of those herbs, a chicken roast, in Jamaica, these are our common seasonings. So, and in China also, China gets a lot wrong, but they get a lot right too. The Chinese herbs that they use are often in combinations of about 15 to 20 herbs. And there are some things that the Chinese are actually doing better than us in terms of health. I'm not in agreement with everything they do, but they're doing better than we are in many respects in terms of chronic illness.
And certainly in COVID as well, because I think they had a jump start on the disease. So they've learned a lot more, and we need to, to learn and to reach out and see why. But just on our topic of early treatment, is it also important to intervene early with the herbal medication? What are your thoughts?
I think that many of these remedies are being used as immunity boosters, and they're being used successfully with COVID, because you have that sudden onset of anaphylactoid cytokine storm, which occurs between days 5 and 11, usually. You have to, if you're going to use these, you have to kill, in my opinion, you have to kill COVID very early and very hard. So at the first sniffle, the first cough, the first scratch in your throat, the first onset of vomiting or diarrhea, the very first symptom in any form, in any shape related to COVID, I usually say you have to kill it like a cockroach. You have to slap it really hard and finish it, because once it gets established and gets down into your airway, it's going to, it's a whole different story. And that ARDS comes on quite suddenly. So
amazing. Well, thanks, Arlene, for enlightening us and empowering us, and on our journey to become COVID champions and COVID competent. This certainly has gone a far way. So an excellent presentation as always, Arlene. My compliments to you. I thank you very, very much. We now move on. We will hear from a COVID champion, someone who is saving lives up and down the length of Jamaica, and particularly concentrated in his lovely hometown of Ocho Rios, is Dr. Michael James. Dr. Michael James is our next speaker. He is not a stranger to our early home-based COVID champion conferences. He's in fact someone with tremendous experience. Tonight, we're looking at over 200 plus years of clinical experience. So can we have Dr. Michael James next? Thank you.
Hi, can you hear me?
Yes, we can, Michael. Over to you.
Right. Thanks. Thanks, Roger, for that introduction. My name is Dr. Michael James. I'm a medical doctor in the parish of St. Anne in Ocho Rios, specifically. And I've seen in the last 2 months, probably over 200 COVID patients. As you know, as it is now, St. Anne is one of the parishes with one of the most significant rates of, the COVID amount, the amount of COVID patients we have is higher than all the parishes. And some of the things that I've been using has been working, and it has been working well. And when you get a good thing going, it's hard to change, and you still can improve on it. All right. So one of the things about COVID is that, as our previous presenters said, you have to find the symptoms early. You have to treat the symptoms early. I've been finding that a lot of people have symptoms, early symptoms, and they stay at home watching it, treating it. Some of them do get better because they are young, they have a good immune system, they can fight the infection, and especially the children. I find a lot of children who have parents who have COVID, they do quite well. But the parents are the ones that normally get in trouble. So I've seen, like, for example, just yesterday I saw a couple, daddy, mommy, they're in their late 40s, early 50s. And the child at home is quite well, but the two parents have one has a bronchopneumonia now and has been sitting at home for the past 7 days. And the female, the woman in that relationship or in that house has just the symptoms, fever, a little cough. She didn't take it as much. But this is one of the things that we need to understand, that if we can recognize the early symptoms, this is where, as our previous presenter said, we should step on that roach and kill it. Because once you have symptoms, what is going around now is COVID. We don't have the flu virus going around. We don't have any other viruses going around right now. I've been looking at throats all the time to see what the presentation is like. And almost all the throats I have to look into have the speckled red dot appearance that comes with COVID infection. And I've been seeing them from day one. So when I see that, I know that this is it. Even if they don't have even a sore throat, sometimes they just have an itchy throat, a scratchy throat, but this is what I've been seeing. So recognition of early symptoms is important. I wish all Jamaicans should understand this or come into recognizing this. And the symptoms are fever, headache, feeling unwell, chest tightness, which is one of the major things. People wait until their chest gets real tight before they reach some other doctors. But as soon as you start having the sore throat or the fever, find a doctor. Shortness of breath, loss of smell, as you know, loss of taste, runny nose now, vomiting, diarrhea. And these are some of the early symptoms. And once you have the COVID infection, you need to have it looked at and treated. So I think our presenter before me was on the dot, and she presented a lot of things that I've been using as well too, in my practice. And one of the things I've been using, I've been trying to make sure that everybody's immune system is boosted. And I've been using that successfully. And they have been getting their vitamin B complex with their zinc, their vitamin C, their vitamin D. And of course, I'm fully into red onion, as our previous presenter said. And the tea, and I've given them 3 times a day. And I've assorted myself with the inhalation as well too, because you can inhale peppermint, you can inhale the ones we mentioned just earlier on. And this inhalation, heat inhalation therapy has been doing tremendous. It does it produces mucus in your airways. And when you have to inhale these treatments, the mucus that is produced traps whatever it is that is there. And then you have this big glob of mucus to either cough up or spit out. And this is what you need, the mucolytics and the expectorants to help with as well too. But even so, with a good chest, you can have that done by yourself. It's one of the things I've been using, and it has been successful. In addition to that, I've been treating them with, of course, antipyretics, acetaminophen being the number one here. And my ivermectin prescription, it's going like crazy. And it's not that I have any qualms with any doctors or anybody else about treating people with ivermectin, but put it this way, once you see it work and it does the job and people get better and there's no ill effects, then what is wrong with that? I'm for it. I mean, I've been using steroids as well too. I've been seeing patients who need an airway repair, and the steroids will come in handy with some antibiotics here. And it does help as well. But I've been finding that ivermectin in the first 5-6 days of treatment is quite good enough to treat patients very nicely. Bronchodilators and people who are on their medications that I've said before are still kept on their medications. Mark, I find that ivermectin does drop your blood pressure a little bit when you're on the initial dosage. And once you start hydrating back yourself or getting more liquids down, you'll find that that does work and correct your blood pressure drop. So it's one of the things that I've been using. And as I said, it's one of the things that all Jamaicans should know, that there's treatment for COVID-19. If you can recognize early symptoms, it can be stepped on like a cockroach and you can be better and you can be treated successfully. Thanks for listening, Neil. Michael James.
Thank you, Michael, for that powerful message. Always early treatment. That is the absolute key to the success and to enable us to come out of this without necessarily resorting to severe disease, hospitalization, and death. So thanks again. Thank you for your amazing presentation. The next speaker continues along the line of oral hygiene and the importance of oral hygiene to the overall health of your body, and also in relation to better able to fight COVID. Our next speaker is Dr. Janelle Dixon, and we'll ask Janelle to take over. Thank you, Janelle, for coming at short notice as our original speaker was unwell. So we thank you, is unwell. We thank you for presenting. Welcome, Dr. Dixon, our dental surgeon for today.
Hi, good night, everyone. All right, let me try to share the screen. All right, I need to be made co-host so that I can share the screen.
There you go, Janelle, over to you.
All right. Okay. Okay. I'm not sure. All right. All right.
Okay.
You can see the screen now or no?
No, I'm not seeing it yet.
All right.
Do you
Need help? Yes.
right? At the bottom, there should be a share screen. Oh,
I'm clicking on
right.
it. All right.
All right, so while that is worked out, let me just remind people at this time that, first of all, let's not be distracted by the trolls. That's the first thing. So clearly there's some trolls on and they get their excitement by putting stuff in the chat or doing stuff with their video. Guys, we're on lockdown. People are very, very bored. And so there are a lot of people who need things to do. So just keep in mind the fact that, see, same thing. This is included. See what I mean? So just keep in mind the fact that, you know, people are very bored and we just give people grace and we refuse to be distracted from the mission. And the mission is, how do we ensure that we minimize our need for hospitalization, minimize our need for any ventilation, minimize our need for significant illness during this time of COVID. And so for those of us in the chat saying, putting up this and putting up that, it's not, I mean, yeah, okay, right? So with that being said,
close the chat, just give me a second.
Please be reminded that we are going to be having a recording. I see a lot of people in the chat talking about, you know, can we get the presentation that was done by Dr. Rose before? Can we get the presentation because it was informative? Don't worry about that. We actually have a recording of this on YouTube. It's on the flyer. You'll see a bar, what's it called? A barcode. And that barcode will actually take you to the YouTube live of this, and you will be able to watch it back again. Any slide you missed or any speaker, maybe they said something you didn't quite catch it, don't worry about it. You are able to watch it again and again as many times as you wish. All right. And so now I just need to find out from Doc if the share screen.
I'm going to go back to Janelle. Janelle,
yeah,
I'm trying, but it's not allowing me to because it's saying something about the system preferences.
Okay. All right. Well, just for the interest of time, can we get can we find out if matron deputy matron Patsy Nelson, Patsy Edwards Henry is here, and to have a few words from her. She was one of our specially invited guests. I think also we have specially invited the Lions Club of Kingston. Is Deputy Matron Patsy Edwards Henry here? You can unmute yourself. Can you find? No? Okay. So whilst Janelle works this out, I may actually just go ahead and do my presentation at this time.
Okay.
And to get things going, to keep things moving along. So I'm gonna go ahead and do my presentation if that's okay. And okay, all right. So I'm just gonna go back to only host can share the screen. Okay, all right. So I'm gonna share my screen. And to go into the presentation. Okay. Okay. Can everyone hear me?
Loud and clear, Doc. Go right ahead.
Lovely. Okay, so this journey is based a lot on Jamaican local experience and the independent public health providers, their message in this regard. I am Dr. Roger Hunter, consultant neurosurgeon, as well as MAJ president-elect nominee for 2021. We recognize the difficulty that our brothers and sisters in Haiti, they've gone through, and we have set up a charity to try and help them. And these funds will be donated through the Medical Association charity. The government of Jamaica has, and not just the government, but healthcare in Jamaica has gravitated towards institutionalized care. And the government healthcare, unfortunately, has buckled under the overwhelming presence of the coronavirus and the disease in the community. Sadly, patients have been left in very difficult states, and oxygen, sadly, has been in short supply. One of the approaches that we have applied in early home-based care is that of permissive hypoxia, where we allow SATs even as low as 70%. Once the patient immediately recovers, then we would allow them to continue. The positivity rate in Jamaica is 50%, and hence that there are a lot of people who would therefore be having COVID as we speak. Therefore, we have to have some ability to treat people early and to treat them in a way that allows them, that will allow them to get the best chance of survival. A lot of funds have been spent trying to isolate COVID, and unfortunately, this has been unsuccessful. Hospitals' occupancy rate have reached as high as 160%, and the lack of equipment continued to be a challenge, not just for Jamaica, but for developing countries. So we're having a bit of a challenge here. It seems like we're properly hacked, but nonetheless, early home-based treatment is geared largely on trying to get people to bring up these awful things that's deep within them. And by doing that, we can improve the oxygen saturation. This is a good example of how when we steam, what we should be doing with our towels covering our heads and a bowl beneath. We should regularly check our SATs, and to do that, we need a pulse oximeter, as we're seeing here. They're readily available. And we would encourage every household in Jamaica to get one. We call on the government to enable Jamaicans to acquire the oxygen saturation meter by removing the fees and a lot of the costs associated with the pulse oximeter. We want to reach a point where everyone in Jamaica, nurses and doctors, teachers, pastors, every citizen, all residents, that they should have someone's contact number so they can be properly guided in case they should have COVID. We also need to be aware of pharmacies or nearby pharmacies and their opening and closing times. We must also, pardon me. So this is an example of someone whose sputum was heavily infected, and with steaming, the sputum is now liberated from inside your lungs. We don't believe that using oxygen is a good way of treating thick sputum like this. And so steaming really helps to liberate your system from these plugs. Oxygen will not remove these plugs. And if you have a pipe that's blocked, then you literally want to unblock the pipe. And steaming is a very, very good way of doing that. As we have seen time and time again, patient after patient. These are actual cases that's happened in the last 24 and 48 hours. So we want to show clearly how steaming has made a tremendous difference to the treatment, the early treatment strategies at home. And it's something that we recommend to be used not only at home, but in all hospital facilities, including government. Again, another example, a good example of how you steam. Now, we need to use that oxygen saturation meter liberally. If the oxygen falls below 75% and it doesn't respond to steaming, then you should start oxygen at home, use an oxygen concentrator. This is all under the assumption that you have a doctor's number and you have contact with a doctor. All public spaces and churches must have this pulse oximeter. And they should also have, in addition to the infrared thermometer, again, picture of a pulse oximeter. What must we do in terms of achieving the goal following acquisition of the pulse oximeter? We must floss, brush our teeth, brush our tongue, and gargle. That process of cleaning your teeth, your tongue, and flossing should take about 2 minutes. We should also then gargle with mouthwash for 2 minutes. We should steam with menthol for 30 to 40 minutes, steaming 3 to 5 times a day. Always send a picture of what you cough up. Do not just keep it to yourself. We actually use the color of the sputum to determine your treatment. So it's very important to send us a picture of what you've caught up, like the pictures we've shown before. And we said all nurses and doctors, pastors, police, everyone, every member of the society should have a doctor's number to allow you to engage in the treatment. You must be able to be aware of your nearest pharmacy and the closing times of the pharmacies. The pharmacies, I'm happy to tell you, they all sell the pulse oximeters and thermometers in addition to antibiotics, steroids, ivermectin, etc. This is a algorithm that we use, and as you can see, steaming is very much a part. Everybody must steam, whether you are COVID positive on test or you're clinically COVID positive. You must steam immediately. You then must also carry the cycle of oral hygiene. Depending on your saturation, then you're going to determine whether or not you just continue with steaming or you add antibiotics as well. So if your saturation is below 90%, then we will at that point we would then introduce antibiotics, dexamethasone, as well as we use blood thinners like Xarelto. Very important. We find that the cough is quite painful and that Panadol and Baralgin and fluids of up to 4 liters per day is very helpful. We have to hear from people in a while, and we've had patients with temperatures of 105, 103, and with Tippett sponge, we can get their temperatures down so that they can continue their treatment at home. Antibiotics that we often will use is Zymax, Zitromax, levofloxacin, Zinat, clindamycin. Blood thinners are usually Xarelto. If the SAT is above 95%, then aspirin is usually enough. For the anti-inflammatory, and Arlene, Dr. Rose definitely mentioned the inflammation that you get with COVID, and dexamethasone was shown last year in a very good study that it actually helps. So we routinely will use dexamethasone once your saturation is below 95%. We would use dexamethasone for about 5 to 7 days and combine that with Pantecta. Everybody who is on dexamethasone will also recognize that you will feel tired once the dexamethasone is stopped. Not to worry, that's steroid withdrawal. What you should do in that case is certainly remain quite rested, be very slow when you get up, drink a lot of juice, especially with a bit more sugar, and that will help you to ride out the dexamethasone withdrawal, which should go away in about 3 or 4 days. We must try and utilize the God bless things that we have here, which is the sun. We have a lot of sun in Jamaica, thankfully. We have a lot of sea and sand. We have the supplements as well. And in addition to what Arlene told us, we should have 30 minutes of sun baths in the morning and the evening. Sadly, for people in northern spaces, and that will become a challenge. Home physio is also important. Immune boosters, actually. Exercise is a very important immune booster. Very, very important immune booster. And this is a good example of what we should be doing in Jamaica. We should take advantage of our great climate, our great conditions to improve our immune health. One of the champions of early home-based treatment occurred in the context of a chap called Egas Manij from Lisbon, was a neurologist who worked with Almeida Lima, a neurosurgeon. And he actually did brain surgery in your home. Now, brain surgery was done at a community level for thousands of years in Africa. We recognize that we are not going to be advocating for brain surgery, but we certainly will be advocating for early home-based care. And in the context of COVID and other conditions, this will become a very important strategy going forward. We need to allow our children to go back to school, and we need to also develop COVID champions of everyone who have attended today and COVID competence. Thanks very much, everyone. Thanks for listening, and apologize for the obvious distraction. Let's go back.
Thank you.
Okay.
Thank you so much, Doc. Before we move on to the next speaker, Doc, could you make Dr. Arlene Rose host so that she can disable the annotation feature for those of us who are
absolutely. Thank you.
So needing of something to do that we have a very important meeting. But you know, as I said, we give people grace.
Yes, we have spiritual guidance here, so we're not worried. And I suspect other pastors are here, and yes, a lot of prayer warriors, a lot of spiritually competent people are here today. So we're not worried. We're
Perfect.
not daunted.
We shall not be daunted, as they say. Get thee behind us, see? Thank you so much, Dr. Hunter. I assume that Dr. Dixon, Janelle Dixon, dental surgeon, is actually ready and able to go now. She was supposed to speak before you. So Dr. Janelle Dixon, let us see if she is ready. Let's unmute her. There she is. All right, so we hand over to you, Dr. Dixon.
All right. Okay, good night again, everyone. So just sharing this slide with you. All right, so I'll be presenting on oral health care during the COVID-19 pandemic. So as everyone knows or should know by now, health is not strictly physical health or being able to jog for half an hour or anything like that. Overall health involves both, not both, but it's not limited to physical health. It includes mental health, social health, as well as oral health. So if we have poor oral health, that can eventually lead to the loss of teeth, which would therefore implicate chewing, how we chew our food, phonetics such as talking. You wouldn't be able to say words like 55, 66, or anything like that. Deglutition. So essentially when chewing, the whole point of chewing is to allow for the enzymes to help break down the food and ensure that we can get as much nutrients as possible. Now, if you're swallowing the food whole or in chunks, you might not be able to absorb all of the necessary nutrients. The teeth also aid in facial support. They aid in having a lovely smile. And if we are not smiling or not happy with showing our smile, that can also affect self-esteem. All right, so oral health is a part of your general health. There's more than 20 billion bacteria living inside the oral cavity. Poor oral health leads to increased bacterial and viral loads in the oral cavity. There is scientifically a link proven to show that poor oral health can affect cardiovascular disease, diabetes. In pregnant women, it can affect them by having premature birth, low birth weight for the babies, cancer, and autoimmune diseases. Poor oral health will lead to an increased risk of stroke and heart attack. There are also ACE2 receptors present in the oral mucosa, especially in the epithelial cells of the tongue. Why that is important is that it's been found and proven that COVID-19 actually binds to these receptors. They're not limited to the oral mucosa, however, these receptors are present in abundance in the oral cavity. Persons with chronic illnesses are at risk of poor oral health because there's a bidirectional relationship between oral health and hypertension, for example, and diabetes. Normally, those persons will experience gum disease, dry mouth due to medications, extensive tooth decay, tooth mobility, and ulcers, etc. Now, the oral cavity, as everyone should know from primary level education, is the starting factor of the digestive system. It's also regarded as the potential reservoir or breeding ground for respiratory pathogens, which can predispose patients to not only initial infection, but it can predispose them to secondary infections. And once that happens, that secondary infection might just be resistant to the treatment that they were initially on. So there are several trials that are currently underway. You have a few that they're not as large in volume, meaning the participants, they're not significantly in great numbers, but there are a few trials that indicate that there is a relationship between oral health and COVID-19. So they have come across that patients with very poor oral health currently have COVID-19. They're also not as responsive to treatment, or their prognosis is actually very poor. So another research that was done indicates that mouthwash can also help counteract the virus. So not all mouthwashes indicate a substantial amount of decrease in the viral load. However, there are results using Listerine and what we call chlorhexidine. And those two mouthwashes have actually been proven to break down the viral cell wall. So signs of infection, let me get this out of the way. Signs of viral infection in the oral cavity. You have loss of taste, dry mouth, a rash on the oral mucosa as indicated here in the picture, as well as mouth ulcers can occur. The COVID-19 prevention measures would include brushing at least twice a day. If you can make it to 3 times a day, that would be ideal, but it should be done for at least 2 minutes. Changing the toothbrush regularly. Normally, we would say to change the toothbrush every 3 months, but once it starts to fray, please go ahead and change them. You should also be using a soft toothbrush. In Jamaica, most persons use firm or a toothbrush that might not even indicate what it is. Please ensure that the toothbrushes are soft. Flossing is highly recommended. I like to say to my patients or persons in the waiting area, don't wait until you have like chicken or mango stuck in between the teeth. Flossing is very, very much recommended, especially at night before going to bed, at least once a day. Persons also forget to brush the tongue, and the tongue is the main vehicle for bacteria. So not just the teeth, we're to brush the tongue as well. Again, using antiseptic mouthwash for at least 30 seconds has proven to decrease the viral load. And also visit the dentist twice a year or every 6 months. These are some flosses, water picks that you can use as well. On the left, you have a picture of the chlorhexidine mouthwash. It might not look exactly like that in certain pharmacies, but chlorhexidine is the key word. You also have the Listerine on the right. This is to reiterate what Doc had said before. And just to note that with COVID-19, it's not just orally that we can be affected. The nasal passages, as Dr. Rose had said before, are also affected. So with all that I have said, steaming does play a role, especially getting into the nasopharynx area. We can just follow all of this here as Dr. Hunter just presented. And that's it. If anyone has any questions, I'm here.
Finally unmuted. I was having some unmuting challenges. Is my camera off? Yes, there we go. Thanks so much, Dr. Dixon. Who knew that some mouthwash and some flossing and just regular oral care, being very cognizant of our oral care would really help us in the fight against COVID. We appreciate that. Thank you very much. All right, so we have our next speaker. I hope everybody is taking notes and making sure that they're paying attention to what's happening here, because these are things that have been working. So our next speaker I'm really looking forward to is Dr. Jermaine Spencer. So Dr. Jermaine Spencer, let me make sure that I get him up, because like all of our speakers, is big speaker, so I have to make sure that I get his credentials right. You know it, no people, right? So he is the CEO of Bay West Hospital, which I understand is one of very few private hospitals that are actually dealing with and treating with COVID patients. And so thanks for that. So CEO of Bay West Hospital and Clinics. He's a consultant, obstetrician, and gynecologist. And last week when I saw him, he had an excellent energy, great information. And so we are looking forward to hearing what Dr. Jermaine Spencer has to say. So I hope they have found Dr. Spencer and unmuted him. Let us see. Dr. Spencer, I'm seeing you.
Yes, sorry, I'm trying.
Dr. Spencer, you look like you're running from somebody. So what's happening?
No, I have to see patients. I have emergency to sort out at the same time. So I'm trying my best to listen. And
We're barely hearing you, Doc. You're very, very low. I'm not sure if your sound is.
All right, you hearing me better?
Not really.
Right, how do this now? Not sure why my sound will be down.
I'm not 100% sure. Yeah, I was just about to say maybe mute and Faithlin, could we unmute Dr. Spencer again? He muted himself. Oh, I've got him here. Ask to unmute.
Any better?
You work with it. Maybe you just have to talk a little louder than you probably normally would, but we will work with it. So Dr. Spencer, we hand over to you.
All right, how are you doing, everybody? Good night, good night, good night. Trying to do multiple things at the same time. I still have a hospital to run, to see patients. And again, thank you for using this platform for us to educate the Jamaican population about COVID and what we can do to limit the morbidity and hopefully the mortality associated.
Dr. Spencer, we are not hearing you at all. You need to turn up the volume on your laptop or whatever device you're using, but we're not hearing you.
I'm trying my best. It's on maximum.
I wonder if it's a situation where you might need to log out and log back in.
Log back in.
Oh, wait, no, we're hearing you. Speak again. Let me see something.
No. I think we might have to go to Dr. Heyman, Leroy, and then come back to Jermaine.
Sure,
if possible.
not a problem. Not a problem.
All right.
Yeah, that's looking like
Let's
that.
get Jermaine to log back in and log out, and then that will work. Dr. Heyman, are you here? I just want to just thank Dr. Dixon for the brilliant presentation. Again, we recognize the importance of oral health in regards to our general health. We remind members of the audience that, in fact, you can get a heart attack, you can get a stroke if you have dental caries, a rotten tooth. You can get a lot of things that really can hurt you. And we just I wonder if Janelle could come back and just relate that to us again. Can you get like a stroke or a brain abscess from a rotten tooth, or can you get a heart attack, Janelle?
Yes, you can. Reason being, you have different cytokines in play right there with any infection present. You'll have like loose plaque, etc., that can get into the bloodstream and actually clog the arteries, clog the blood vessels in general. Abscesses in the mouth can actually lead to an infection to the brain if not treated properly. So there are certain persons that will come in, they'll have an infection.
Oh, sure,
They'll have an infection of an upper tooth, for example, and come in with a big swollen cheek when actually the infection can continue going upwards to the brain.
Absolutely. And again, in terms of mouthwash, I recognize the critical importance of oral hygiene and mouthwash in particular, but how long you have to use the mouthwash for before you're killing viruses and bacteria inside your mouth?
All right, so there's a few studies that have said at least 30 seconds. There's a few that say 40, but at least 30 should be sufficient.
Right. I think we generally recommend like 60 seconds in regards to coronavirus, because the studies show that the virus died after 30 to 40 seconds. So to be safe. Yeah. Yeah. I think Dr. Phillips last week, he also resonated that as well. So, so do you find that just for your general well-being and your feeling of well-being, that having a fresh breath or a fresh taste in your mouth, that helps?
It's not so much the fresh breath or fresh taste, but the antibacterial component of the mouthwashes is what helps to break down the viral wall, the viral envelopes.
Absolutely, and right, the very severe action. So again, thanks a lot, Janelle. We can't get enough of dental health and dental hygiene in this approach to successfully overcoming the corona scourge. So we're gonna hand over to Dr. Leroy Heyman. Is he here, Leroy? Are you
good night, everyone. Yes, I'm here. Yeah, good night, everyone, and thank you for being part of this very important forum tonight. We do apologize for the measure of hacking we're seeing, but nonetheless, please do not be distracted, but stay focused on the primary message that we are trying to bring tonight, and that is early treatment of the coronavirus. We monitor you in your homes, and this undoubtedly will result in less hospitalization and death. Dr. Hunter, can I have permission to share my slide, please? Dr. Hunter? I would love to share my slide.
Dr. Hunter, you're going to have to take back the host privileges from Dr. Rose.
Go ahead, Dr. Heyman, you're free to share now.
Okay, thank you. Okay, all right. So I'm sure by now we all realize that we are in a crisis situation here. I am practicing in central Jamaica, Maypen, in the parish of Clarendon. And most of what I'll be sharing tonight is largely from my knowledge of the COVID-19 infection for over 20 months now. Also from my personal experience as a patient, and also the experiences I'm gaining by treating my patient. Now, when we think of coronavirus, or when we think of COVID-19, many thoughts come to our minds. One of them is that, okay, let me take the vaccine and then I'll be protected to some extent. And then if I do get an infection, it will be a mild one. On the contrary, what is happening now is that the evidence is pointing that persons who are unvaccinated, they're the ones who are getting very ill. They're the ones who are ending up in hospital, and they are the ones who are dying. So we want to highly recommend to all our this audience tonight to make sure that you take your vaccine. I mean, our figures are really alarming. Jamaica, the last time I checked, we were like below 10% fully vaccinated. And we're hoping by the end of this month that figure may move to around 18%, as those who have started their Pfizer vaccine maybe 10 days ago will complete in another 10, 11 days time. So that should increase our figures above 10%. And then those who are getting their second dose of the Oxford AstraZeneca will indeed cause our percentage to be increased. So I want to encourage everyone on this side to make sure that you get vaccinated, because the data is correct, the reports are true. If you do take the vaccine and you do get a coronavirus infection, your infection would be very mild. We also want to think of coronavirus in another light. There are some people who think of it as, boy, I get sick, I may get severe, I may end up on oxygen, I may end up on the ventilator, and I may end up dying. Those are really bad thoughts, and we don't really want to think along that line. But when I add up the number of deaths for the month of August, we are about 353. And I mean, that is alarmingly high for 1 month of death from persons dying from the coronavirus. So this is really and truly alarming. And so tonight, as part of my presentation, I want to bring another dimension into the discussion. And this dimension is basically focusing on a pre-hospital care. In other words, we are trying to strengthen tertiary prevention. In other words, we are trying to offer a type of treatment that will most definitely prevent you from going into the hospital and even more so to die. So I want to show you my flow chart that I use, and of my algorithm. And I've simplified it so that we all can understand. Now, we have been talking about early treatment for the past 3 weeks. Other physicians in the island has been talking about it from before. And tonight I want to explain a little bit why what we're doing is important, and you will understand why we do things the way we do. Now, I would like to define early as the first 6 days of your symptoms. Now, if you start to have a headache tonight, if you start to get stuffy nose, we call that day 1 of your symptom. Now, I'm sure we all get that based on the presentations we have had before, but I just want to emphasize that point. Now, you did not get the virus today on day 1. You acquired the virus about 1 to 14 days prior to that. And usually we use an average based on what I see in my practice in MAPE and Clarendon. The average is usually around 7 to 8 days. So if you cast your mind back, say 7 to 8 days, you will realize that you went someplace, you took off your mask, or you traveled and you took off your mask, or you went someplace, or somebody visited you, they didn't have a mask on, you didn't have a mask on. So the possibility of getting the infection was possible. So from day 1, we count onwards each succeeding day as day 2, day 3, day 4 of your symptoms. Now, as I said in my previous talk, nobody start to have symptoms today and end up on the ventilator tomorrow. I mean, I've never seen that. Or nobody start to have symptoms today and end up dying. It means that you have passed through at least 14 to 21 days for you to be able to reach that stage. So when we speak of early treatment, we're talking about hitting the virus. And I love the words that my 2 presenters, Michael and Dr. Rose, I think, presented. We want to hit the virus hard, and we are going to hit it in such a way that we will actually weaken it or try to eradicate it in the first 6 days. Now, one of the things that we have encountered since the first case in March 2020 is that we were very good with the initial protocols of the mask wearing, the physical distancing, the sanitization. But the 4th one, where we were saying to our patients, isolate, stay at home, and if you get worse, then you go and visit the hospital. That, I believe, is where we went wrong. That, I believe, is where the breakdown took place, why so many people got severely ill, and we have seen so many deaths right across this island and across the world. Now, it's very, very important to understand what we are trying to say now, because what we're actually trying to say now is that instead of isolating and staying home, we're saying to you, you need to come and see the doctor in those first 6 days. Now, I want you to understand why we want to see you, because I said before in my introduction that when your symptoms start day 1, you acquire the virus at least 7 to 8 days prior to that. Now, a lot of things start to happen. Your body fighting mechanisms start to take place. Secondly, the virus starts to multiply, and it will multiply and continue to multiply if you allow it to do so. And thirdly, what happens also is that you start to get inflammation or soreness of your organs, mainly your heart, your kidneys, your liver, the gastrointestinal tract, and your kidneys. And the symptoms start to come. And another important one is your blood vessels. So we start to have early inflammation. Now, if we're going to hit this virus, we got to hit it from here. We can't allow this infection to go unhit into a second week, or even worse, into a third hit. And so you need to understand that this is why we want to hit it right here. We want to decrease the viral load. In other words, prevent the virus from multiplying, and we want to treat early inflammation to make sure that your outcome is quite good going into the second week. Now, when you come in during the first 6 days of your symptoms and having established the diagnosis using one of our testing, whether the antigen test or the PCR, which is more accurate, once we make that diagnosis, we start to initiate early treatment from the day you come in. And our treatment includes, first of all, looking at your total history, identifying any comorbidities, any existing medical condition, and very, very important, we start to attempt to get those corrected. No, we don't expect them to get corrected the day you come to us instantaneously, but we try our very best to put all the possible measures in place to make sure that these illnesses are treated and they're treated properly, because the data is correct. I mean, we know this from March 2020, that persons with comorbidities, your outcomes seem to be grim. You have a more severe chance of getting a more serious infection, and the possibility of death is very real. So we address your comorbidities and we treat them. That's why we want you to come to our offices so we can establish what your present situation is, and then we address those instantly. So the next thing that we do, we use a set of what we call non-pharmacological measures to try to hit the virus. And when we try to use these measures to hit, I hit them very hard. So some of them have been mentioned already, like the menthol steam inhalation. Then we look at your hydration level. We find a lot of persons are coming in quite dehydrated because you lose your appetite, you're not drinking enough, you're not eating enough, so you're coming in very weak. So we look at your hydration, we look at how much fluid you're taking in, and we try to correct that. On an average adult, you need maybe 3.5 to 4 liters of fluid per day. And we recommend that in the form of water with vitamin C and zinc, coconut water, juices if you're not diabetic, and of course, as was mentioned before, teas, warm beverages. We also encourage mild exercises. We encourage you to walk, keep walking, keep moving. In other words, we want you to put up a fight. We want you to start fighting this infection. You can't sit and lie down and fight the coronavirus. No, you have to get up, you have to drink, you have to eat, you have to become a true soldier to try to fight this thing. And we recommend also sunlight exposure. As we know, we have a lot in the Caribbean, in Jamaica, and that will help build your vitamin D levels, which also adds an important part of your immunity. We also teach you breathing exercises to help you, because if you should put your pulse oximeter on and you take 5 quick breaths, you will realize that your level will move up by 2 to 3% inside your house. If you go outside in the fresh open air and you take deep breaths out there, you will find that it increases even more than that by 4 or even 5%. So all that I've just said from the non-pharmacological point of view, I have in my office these listed in a nicely, neatly form, and we hand this to all our patients. Whether you want to take a picture of it or you want a hard copy, we will give it to you, and you are there to remind yourselves of the non-pharmacological methods that we use to hit the virus in the first 6 days to weaken it, so your outcome would look bright going into the second week. And then we add some pharmacological medications. And now the main one is we had an anti-fever or antipyretic medication. Sometimes you come in with pains in your joints, in your muscles, a headache, and then we give you simple things like Panadols to help. Panadol is an antipyretic, it's an anti-inflammatory. And if you are a mild case, then you maybe won't require anything more than that. Now, I should point out that one of the reasons why we want to see you in our offices in the first 6 days is to put you into a risk category. If you are a healthy person, if you don't have any comorbidities, if your weight is right, your BMI is in the normal range, then we assess you as being mild, a mild case. If you have some form of comorbidities, then you may be moderate. If you have multi-comorbidities and multi-symptoms, then you would be at severe risk. So if you're at severe risk, then we tend to add medication that will help you to decrease the viral load and decrease also the inflammation of your organs. And don't worry, we will find them in the outpatient, we'll find them in our pharmacies. They vary in price for maybe $1,100 for a dose of medication to as much as $240,000 if your pocket can go up to that. But we will give you the options, and if needed, if it's needed, then we will recommend that for you. Now, so if we're gonna hit the disease hard in the first 6 days. And as I said before, this is where we went all wrong. And this is what we're carrying into the discussion now, that every single Jamaican need to know this, that in the first 6 days, if you have any form of symptoms, as Michael described, Dr. James described early on in his presentation, the headache, the fever, the stuffy nose, the chills, the short of breath, the sore throat, the vomiting, and the diarrhea. And while I'm on that subject, let me warn you that the Delta variant, it comes with more severe symptoms. Diarrhea, vomiting, and dehydration are things that we need to look out for with this particular variant. So having seen you in the first 6 days, and we start you on our treatment protocol, or our treatment regime, I should say, we send you home. We send you home. Now, when you go home, I want you to understand what we do, because you are going to be monitored at home. We're not going to just send you home and tell you if you get worse to come back. No, we're not going to do that. The way it works is that we have your number, our numbers, you have our numbers, and we communicate. If you're a mild case, we communicate maybe every 3 days. If you're a moderate, we say maybe every 2 days. If you're severe, then we communicate every single day. And you call us and we pick up early if anything else is going wrong, and we try to address it while you are in the confines and the comfort of your home. As Dr. Hunter mentioned before, we recommend the use of a pulse oximeter. You can check your oxygen saturation, and you can give us a reading, and we will use that as a guide to see if you're progressing. And we also use worsening symptoms to see if you are deteriorating. So our treatment, as it says, is early treatment, but home-based monitoring. One of the things I'm finding in public practice is that because the clinics and the hospitals are so overwhelmed, if you come in with mild symptoms, the truth is that we don't know who is going to convert into a more severe form of the illness. So instead of sending you home and saying, come back if you're getting worse, we have a situation where we are highly recommending that we monitor you at your home in the ways we described there: phone calls, text messages, WhatsApp messages, and whatever other media we can use to communicate. We communicate so we know if you are getting worse. Now, having seen you in the first 6 days and having hit the virus, I can tell you that we're seeing some very, very, very favorable outcome, because coming into the second week of the infection, we'll find persons who had a mild infection, they're coming back almost cleared up. Those who had moderate infection coming back smiling again. And those who were in the moderate risk category, they come back, and sometimes they progress into a more severe form of the illness. Now, during day 7 to day 14, this is when the disease takes its turn for the worse, if days 1 to 6 goes unattended to. If you ignore days 1 to 6, then your outcome going into the second week is going to be grim. And it will put the physician under more pressure now to find more measures to try to get you out of that state for your outcome to be much brighter. So the patients we are finding who follow our measures that we mentioned from day 1 to 6, most of them come back happy. by the time day 7 comes. And so when we review you at that time, we look out for worsening symptoms and we look out for possible signs of deterioration. And one of them is that maybe your oxygen saturation start to fall below 93. And then again, if you do so, no need to panic. We have medications available in the outpatient department, in the pharmacies. We tend to add the steroids, we tend to add blood thinners at this point, and usually the outcome is tremendous. Usually 4 days on this therapy, everybody normally comes back smiling. I always look forward to day 10 of the illness because this is when I see most patients coming back, and they're coming back with true smiles, and you can see that they are improving. Now, if we go back to day 1 to 6, you will realize that I didn't mention antibiotics, I didn't mention steroid, because most of the time you do not need it in those early stages. It's a virus infection, it's inflammation, it's viral replication. So we aim to hit that first. We don't, I mean, from all my treatments since April this year, I've only seen 1 case of a severe tonsillitis in the first 6 days, and then I added antibiotics to that patient. But usually I'm very skimjy in my practice in Maypen with medication, and perhaps maybe 1 to 2 medications you get in the first 6 days, and in the second 7 days, from day 7 to day 13, if I have to give any medication, it's going to be 2 medications, a steroid plus the blood thinner. Of course, if you come back very severe, where your oxygen start to fall below 90 and you're looking very dehydrated and you're going to need fluids, you're going to need oxygen, then of course we have to refer you to the hospital. But I'm pleased to say today, after 5 months of doing this, I have not yet sent anybody into the hospital. 2 cases I considered severe. One was a diabetic who went out of control. His oxygen saturation went down to 87. Dr. Hunter will tell me that is nothing to be alarmed or panic about, but the patients tend to panic once it starts to go down. So the family was able to afford oxygen, so they bought the oxygen for him, and he was able to go on it just for 2 days. And then with the other measures put in place to correct his diabetes, he was able to be weaned off the oxygen after 2 days. I had another hypertensive who I got on day 10 of the illness, not in the early stages, and she went dehydrated again. Her O2 started to fall below 90, it went down to about 87. We had to hydrate at home. We had to put on oxygen. This we did with a professional nurse monitoring those gadgets for us. And so the outcome was that she recovered quite well. We were able to wean her off the oxygen after 5 days. And today she's reporting much, much better. She's breathing, she's walking up and down. She's not fully well as yet, but it made a significant difference in the treatment. From day 14, we bring you back for an assessment. And then at this stage, I mean, most of our patients would have recovered or on their full maximum recovery. And if we just start to address the other things like counseling, we continue to give you energizers to get fit. We recommend exercises and physiotherapy to get you back fit for the workplace. And after maybe about 1 week of rest, then we usually get you back into your normal lifestyle. Now, of course, this early treatment and this home-based monitoring is not without problems, and I like to highlight them quickly before I close off. We mentioned the diabetic who went out of control, and it was a challenge to monitor that one. But once we got the sugar and the pressure control, their outcome was very good. There are also patients who have psychosocial problems and financial problems. One of the medications we use is the blood thinners, and that is the one that account for the highest price. They were unable to buy it. So in one patient had to call their company to assist them. And this they did willingly and gladly, and they were able to get the medication to ensure that they had a good recovery. So we do have psychosocial and financial problems. Of course, couple days after the illness, some of them do have the long COVID symptoms, but we believe with physiotherapy and hydration and other measures, they will be able to come back, because I am one doctor who is convinced that with the early treatment I'm talking about from day 1 to 6, if our patients get treated from that stage, then these long COVID illness affecting the kidneys, the heart, the lungs, the brain, I believe that those don't have to happen. And I am one example. I went through the illness, and I'm pleased to announce that all my tests have come back normal. And I believe that we can have our own Jamaican experience. We don't have to look what people who practice in other countries are saying. With regards to that, we can do our early treatment here and see for ourselves that some of these long COVID symptoms that are identified, our patients here in Jamaica don't have to endure them. And the good thing about it is that my patients, they love being treated at home. They enjoy the comfort of their home, and that was a tremendous advantage to them. And my patients are doing well. When I prepared the slide, all of them had recovered, but I get new patients every single day. And so all my patients are recovering, and they are recovering well. And even more important, I have had no deaths since April 2021, when I started to treat COVID-19 patients. So in summary, I would like to emphasize again that the vaccination, primary prevention is very, very critical at this time. There are a lot of blitz being organized. Workplaces are organizing vaccine days in their companies. The Ministry of Health is going to organize coming into the communities. So please look out for the vaccination sites where there are, and please get vaccinated, because as I said before in my introduction, the reports are sure and they are true that persons who are vaccinated, if you do get the COVID-19, you'll get a milder version of the illness. And early treatment does prevent hospitalization, and early treatment does prevent death. And as I mentioned before, my patients love that. And this definitely will take off the load off our heavy burden hospital staff if we treat early and monitor the patients at home. And we are in a launch now, we are in a program now, we're encouraging more physicians to come on board, to be a part of this treatment, so more patients across the island can benefit from this, these measures we are taking. So in closing, the message is simple. We want to catch you in day 1 to 6. We're going to treat you early, and your outcome will be favorable. You won't have to be admitted to the hospital. There will be no need for field hospitals. We don't need to bother people from other countries to send medical ships out here to assist us in our treatment because of the overcrowding. But if we follow these guidelines that we're putting forward tonight, as we have brought this now into the discussion, early treatment works, and this is what we're recommending to all Jamaicans and indeed everyone who is listening to me tonight. Thank you very much for your attention, and I will be very happy to answer any question on this subject in the discussion period. Thank you.
Thank you, Leroy. Again, another comprehensive and experientially grounded presentation. And, you know, Leroy, I do understand that each physician or COVID champion has to kind of work out for themselves their boundaries. So, Leroy, can you just share with us some of the extreme cases that you've had to manage? Just say 1 or 2 that push you to the limit, and yet you came out with a successful outcome.
Well, as I mentioned before, Dr. Hunter, that my first challenge was with a diabetic patient who his family heard that he was ill, so they sent a lot of Gatorade for him. I'm not advertising for Gatorade, but they sent that particular drink to him. He drank quite a lot, maybe more than 12. And so he came into my office looking all ill, very dehydrated. And when I looked at him, I said, wow, what happened? And then when I checked his sugar, it went up to near 30, it was 29.6. And so I had to quickly switch his medication from oral to the insulin. It took me about maybe 3 days to get him corrected. We got him luckily he could still drink oral fluid. So we were able to hydrate him back quickly after 2 days. And we gave him the oxygen for 2 days. And then he came back. And up to this morning, he called me and he was asking me if he could go back to work now. This is about 2 weeks after the infection. And I said, yes, you can now go back to work. My second most challenging patient, as I mentioned, I got her after visiting another medical facility. She came to me on day 10 of her symptoms. And as I mentioned before, if the disease is going to take a turn in some patients, it's going to start happening from around day 6, day 7 to day 14. And so when she came to me, she was quite ill. We started her very quickly on the guidelines I mentioned. We put her on the steroids. We were able to put her on the blood thinners. And then after a couple of days, I realized that she couldn't manage the steaming. And so workplace called me, and I'm pleased to say, boy, I'm so happy I can big up Jamaica Broilers tonight. They really pay a lot with their workers, and they were able to get the oxygen supply. We were able to identify a nurse to go in and to monitor her. We were able to address her fluid balance with an IV line. And so we treated her at home. And after 5 days, we were able to wean her off the oxygen 6 on room air. And when she takes her deep breaths, as I mentioned, it goes up to 97, 98. So I presently have one with multiple risk factors. She has about 8 different medical conditions. And the good news is that she heard about this forum, and her daughter, who is a patient also, brought her in on day 3. Already she started to have thick, coarse crackles, which suggests that the infection is spreading into her lung. And so I was very aggressive with my treatment with her. I just started her yesterday, and she's down for review tomorrow. So all the high-risk ones, we see them regularly, and we ensure that they do well.
Oh, thanks for that, Leroy. And you know, sometimes the critical mind will say, well, no, we're just seeing the easy ones. They're the mild categories, maybe the 15%. They're not the real tough cases. So tell me, Leroy, I mean, what you've described, I don't think we could classify it as mild. And would it be safe to say that had you not intervened for those cases with the sugar of 30 in the community or in their home, that those persons would probably end up in hospital in a coma or die? Leroy?
Well, I wouldn't say.
Oh, you're breaking up. Your reception is.
The added facilities, yes.
Yeah. So.
Is bad?
Yeah, come back.
Can you hear me?
Yeah, so, yeah, with a sugar of 30, that's not being treated, and with low oxygen levels, where would that patient normally end up if you didn't break the natural deterioration or the natural progression of the disease?
Well, of course, I mean, that patient would definitely considered as a severe case, and severe cases will have to go to the hospital. But because we monitor them, that's why I believe the home monitoring is so important. We do not send them home to just leave them like that. They communicate with us. So they are able to tell me, Doc, my O2 sat is 87. Doc, my blood sugar is 25. They are able to do that. And then I can put in corrective measures early so we prevent them from going into the hospital. Of course, if a situation arises where I have to send them, then I wouldn't hesitate to put them there and to ensure that they get the best treatment also in the hospitals.
I mean, clearly, it's very important that.
Oh, one more thing, Roger, in answering your question, remember now, we do not know who is going to convert into a more severe infection. So, because sometimes even the mild cases we would think, not going to convert. I've seen some of them converting into a more severe form. And that's why I think that by doing the home monitoring, we can pick up early if they are deteriorating, and we can address the situation quite quickly.
Absolutely. And thanks so much for that. I mean, when I had COVID, my oxygen levels were in the 70s. So, but, you know, I kept calm like a deep sea diver, you know, just kept calm, reduced my oxygen demand, and just steamed, and my SAT came up into the 90s. We're also seeing people with very high temperatures with 103 and delirious, and we treated them calmly at home, and the next morning they're eating breakfast. So it would be safe to say that somebody with a sugar of 30, or someone with an oxygen saturation in the 70s, or someone with a temperature of 103 would naturally progress if you did not intervene and stop that. I think,
yes.
Yeah.
Agree, totally agree, yes.
And then with the situation in our hospitals, that's one less bed that we have taken up in the hospital, and one less ventilator.
In my case, two less beds, definitely.
Absolutely. We have several, actually. I've had several examples, because my boundary.
Maybe five bottles of oxygen also.
Absolutely. And I tend to not to rely a lot on oxygen, but I tend not to give someone a reason not to take a deep breath. I always try to apply the principle of permissive hypoxia once you have that oxygen saturation meter, because nobody's going to die with an O2 sat in the 80s, or I dare say in the 70s. Certainly it's in the 50s and the 40s, you're really getting into trouble. But close monitoring, when someone's SAT is in that low level, then you may be calling them instead of just having them on a portal. So absolutely, Leroy, I think you have saved the health system quite a number of cases, and as you become more enabled to save the hospital systems that have buckled. And I think it's important that people hear this message, that you must find a doctor who is COVID enabled. Not all doctors are comfortable treating COVID, because there's still an element of fear that you're going to die. And so that is something that is it's human nature. But you must find a doctor who is COVID enabled. Thanks very much, Leroy. I really appreciate your contribution as always. It's always been an amazing journey. So thank you.
Thank you. Thank you.
I think at this point, Dr. Jermaine Spencer, is he back with us? Can we reach out to Jermaine?
I'm not sure if my volume is
much better now. Much better.
I'm not sure what happened the last time.
Not sure. I yield to you, sir. Over to you. CEO of Bay West Hospitals, treats both home base as well as in hospital in critical care. Thanks, Jermaine. Enlighten us.
Sure. Good night, everyone. Again, thanks for inviting me to speak. I mean, we all have the same goal, which is to ensure that the patient recovers from this horrible and deadly disease. We don't want to downplay the fact that this COVID is a serious respiratory issue, and it is causing homes to be turned upside down, breadwinners to die, families to be left unattended to, and it's just horrible. And our aim, which is what I must commend you, Dr. Hunter, for, is to try and educate the Jamaican population about what the steps to take whenever they get it. But I also want to reiterate the point that is pushed by the Medical Association and the Ministry of Health and the government of Jamaica, is that you have to follow protocols. You have to wash your hands, you have to sanitize, you have to try and stay 6 feet apart, you need to wear your mask. The principles are still the same. The virus gets in your system through your nose and your mouth mainly. Your eyes to a minimum, but really through your nose and your mouth. So the mask is very important, especially in public place. But also remember that people in your household, you still have to educate them about how do they prevent themselves from getting it, because it's at home when you let down your guard is when the issues normally arise. I mean, I'm in the health system. I've got COVID, I've recovered from COVID, and yes, I'm exposed by seeing patients in a closed environment. I don't see patients on the outside, but we have to educate them about prevention. Prevention is still the primary means of getting over or preventing from getting the COVID. Vaccination, especially now, especially when all of our health facilities are buckled under the severe pressure posed by COVID. I mean, we had our problems before, but my God, the issues associated with it now, we can't stress it even more. I mean, the vaccination blitz are going on. People are getting vaccinated. It's 500,000. The number is climbing. We need to get that number climbing more and more because the vulnerable population still exists. And it's the vulnerable population that the COVID really kills. The people with the comorbid issues, the people who have issues with medical problems. However, there are those who have no issues, and there are people who may have a comorbid issue which they're unaware of. So the message has to be the same right across, regardless. Protect yourself, immune up, vaccinate up. I know there's a lot of people who have recovered from the virus. We still encourage these people to wear their masks, control comorbid issues, even if you have not gotten it before, or even if you're vaccinated. And again, the vaccination shows to work, but there's still some debate about how long does the vaccination work for? How long will it take for us to need a booster? It's still up in the air. But the point is that we need to improve our immune system naturally by diet, exercise, controlling comorbidity, and of course, taking the vaccines. Fortunately enough, at our hospital, at Bay West Hospital in Montego Bay, we have space where we could have outsourced or could have outfitted, I should say, for management of moderate and severe COVID patients. We don't want you to be hospitalized. The cost factor is just, it's unbelievable what we have to pay, not only for staffing, not only for medication, just the resources that are needed to keep a patient alive, especially one that's on a ventilator, on a high flow machines. We don't want you to come to the hospital. We don't want you to come to the hospital. Yes, we're having a good recovery rate, but we still don't want you because the price is ridiculous. And I have to say this because medications and healthcare is expensive. So that is part of the reason why I'm here to stress pre-hospitalization care if you get COVID. Any signs, anything that may suggest of COVID, runny nose, cough, headache, we have to test, and we have to test early, isolate, and treat early. 3 important things. Test early, if positive, isolate, and treat. So it's not just stand on your yard, it's stand on your yard and treat. And we just don't know who will make a wrong turn, who will get a bad turn. So we want to treat everybody as if their immune system is bad. Is a possibility that they may go on to be hospitalized. So we have to ensure that we start all the high dose vitamins. We hydrate, we rest, we hydrate, we rest. Take the antibiotics. I mean, azithromycin, if you're allergic to that, there are others you can use, doxycycline, etc., to prevent any form of pneumonia. The medication that everybody talks about, and it clearly shows based on meta-analysis of different studies that it has some strong benefit. Ivermectin, it's getting a fight, but I have seen it with my own eyes that it works, it works, it works. Cuts down the viral load, creates an anti-inflammatory response, it decreases your inflammation. We have to push the message that the treatment is available. The pre-hospitalization treatment is available. Far cheaper than hospitalization, and it's definitely far cheaper than a funeral. And I want to make that point. You have to spend your money early to prevent that funeral money. And I mean, nobody wants to get to that point, but we have to be realistic. We have to understand that people are dying. Don't save up and you're wondering where you're going to go and get it, and treat yourself early. Test early and treat yourself early. I don't know how much more to spread, to share it. I don't know how much more to say it, but we have to treat patients early. Whether you have comorbid illness issues or not, whether you're vaccinated or not, whether you're unvaccinated or not, and healthy. We just don't know. the Delta variant is such a contagious and unpredictable virus. We just don't know. And every patient we must treat hard. A lot of the management as a physician outside of COVID is the psychological support. I have to give so much psychological support to patient, whether by voice, WhatsApp, text message, Instagram messages. There's a lot of fear, and it's warranted why there's so much fear and anxiety. But we need to alleviate the fear, because there's a study that came out and was published that showed that anxiety is actually a comorbid issue that actually makes you're able to recover from the virus worse. So we have to address that. We have to address the psychological aspect. You need to find means of de-stressing, exercise, outdoor activities, games, whatever it is. We need to address the anxiety or the psychological component. Health is still about not only the physical, but the social aspect, the psychological aspect. We have to treat everything as a whole, treat the patient as a whole. Please, we need to ensure that we get this message across. That again, boost immunity, any signs of symptom, test, isolate, and treat early with medications. All right? We don't want you in the hospital. We just don't want you in the hospital. Pre-hospitalization definitely works. Again, Dr. Hunter, thanks again for inviting me on this forum to speak about this. And at any point in time, you can call upon me. But we have to get the message out to all Jamaicans that if you have any sign of COVID, you must test early, you isolate, and you treat early. All right? Thanks much.
Jermaine, thank you. Again, such honest and frank experiences that you've shared. I mean, it's clear that you have your heart in the right place. It's perhaps more financially beneficial for you to have patients in your ICU. But here you're saying there's a greater calling. Let's get them treated at home. Let's keep them out of your hospital. How great is that? And I mean, I salute you for that. And certainly we recommend all the measures, including vaccination, so long as you're not COVID positive. And we recommend that clearly testing be done in that context. But we need all measures, all aspects of the measures, including excellent oral hygiene and steaming, along with social distance. So Jermaine, thank you so much. And thank you for, this has been a rough day for you. It will continue to be a rough ride, but we hopefully, if it's even one patient that we have stopped from going into the hospital, it's worth it. Final comments just for now?
My pregnant ladies, the COVID hitting the pregnant ladies. And I need to tell them that they need to get their vaccines. They need to get some level of immunity up. And whenever they have any symptoms, they do not neglect it, especially in the third trimester. They're not doing too well when they get it in the third trimester because of the abdominal effect of the pregnancy and the issue of the diaphragm and the ability to inspire or to breathe in and breathe out is affected, and the ability to cough up and get the sputum out. So I need my pregnant ladies to be extra careful. Please be extra careful. Just see out the pregnancy. Extra careful. That's all I have to say, you know. I'm seeing it. I'm seeing my ladies. I'm seeing them being infected. And I want my pregnant ladies to be, please just protect yourself. Protect yourself, protect yourself, protect yourself.
Thanks again. I think pregnant ladies, which really is a very important message because they carry a very precious package or packages, and it's really important for them to hear this message. Early treatment. You cannot be too vigilant when it comes on to symptoms in COVID, especially if you're pregnant. Speak with your gynecologist, speak with your obstetrician. A lot of doctors have already gotten COVID, including obstetricians. And was that the same for you, Jermaine? Did you have a COVID journey, personal journey?
Personal journey, definitely. My situation was, I felt like I had dengue, you know, body aches, chills, fever, stuffiness. Honestly, did the test, found out I was positive. I was very weak. I literally checked myself in my hospital. started medicate. I said, listen, guys, you know I can't go anywhere, so just hit me hard. And started antibiotics, started fluids, started vitamins, started antibiotics, started, of course, ivermectin. And I honestly checked myself out 24 hours later. Walked out and said, listen, I'm going home. And I continue my management at home. And right through, it was a rough patch. It took me about 10 days to really start to feeling myself. But from my journey, the biggest thing was rest. I just had to rest. I literally just had to lie down. With my personality, that was very difficult. But every time I decided to get up, my body was saying, boss, just try sit down. You know, and I've had friends who had to sing and they were teasing me, you know, they're non-medical. And they said, take my advice, doc, just try rest.
Yes.
Because it takes over your body. It's just malaise and the fatigue and the feeling. It affects it, even your ability to think. I must tell you. I mean, I've had at least 2 friends where psychologically they thought they were getting mad. You know, it really affected. And these are big grown men. And they literally said to me, boy, Jermaine, this thing really affect my mind. And I mean, we haven't talked a lot about COVID and the mental state, but I tell you this, I tell you, it affects every facet of your body, every facet of your body. But we recovered, and we just have to follow the medication, the protocols. We will recover. And again, I know Jamaica feeling it, but we will recover. And I tell people this, every wave must crash, you know. There's no wave on the seaside for just stand up and you sit and watch it, you know. It must crash, and we will recover. But we have to be strong and smart to protect ourselves. I tell people as well, I mean, I might divert in a bit, but I'm very emotional about it. It's not all about vaccination. Vaccination is key, but simultaneously, we must be fixing our health facilities. That is what's going to decrease our morbidity long term. That is what's going to decrease our mortality long term. We must have a plan for that. We must have a plan for that. Because hear what? They already tell us that there's a variant out there that is mutated and coming again. Then what when the next wave come? We have a plan for it. And I want that message to go out very clear. And when it comes on to the management of health facilities, and I see what's happening, it hurts my heart. We have a plan for it. And I mean, I know I should have finished a long time and you pushed me this side, but we must plan. This wave must crash, you know. It will come to an end, people. And I know it will come to an end. But guess what? It's out there already. And next one will come, and our next one will come. Is how we plan for that one and use, as I always say, our little bit of money wisely. The little bit of money where we have. We don't want a situation in Jamaica where we're paying for vaccines every 6 months and every year, 14 million US dollar every year. And then the Jamaican dollar goes up to what? $300, $500 to one. And who can buy bread? We must be smart.
Absolutely, Jermaine.
I'm not a politician, but I'm a well-thinking individual. We must be smart with it.
I really appreciate, again, we need to, this is the time to reimagine healthcare, to go back to perhaps where we started. And this pandemic has really brought us into a greater sense of medical literacy. People up and down the length of Jamaica and across the world are understanding pulse oximetry. What's an oxygen saturation? What's the oxygen saturation level? What's your infrared thermometer? What's that? And so it's really released a wealth of medical information into the hands and minds and hearts of the public. And with that information now, we're having people who are better medically enabled to assist with their individual care. So the hysterical person can measure their oxygen saturation and not necessarily run to the hospital if their saturation is 100%. But what I recognize and draw the parallel between 2 presidents, and it's not any disrespect or anything, President of Bay West, Dr. Jermaine Spencer, and the President of the United States of America, Donald Trump, past president, both are high, you know, very, very hardworking individuals at the time. But the COVID journey was characterized by early detection. Hospitalization was very brief, and then the recovery was there. So it's very important to hear the message that you can catch it early, minimize your hospital stay, and continue your journey at home. Very important. And rest, that good old word, it had disappeared from the modern lexicon because it's such a fast-paced world. But this COVID is forcing us to rest. So like you, I had to rest. And within that rest, we reduce our oxygen requirements. So your oxygen tolerance, what I call relative hypoxia and your happy hypoxia can take effect. So your oxygen levels can go down to 80% and you're not in distress. So that's very important to apply rest. And so you wouldn't need necessarily to resort to an oxygen cylinder or, certainly we believe that AGL would not be under that amount. IGL would not be under that amount of pressure if a lot of us would rest and to be calm and to be more relaxed as we overcome this infection. But Sir Jermaine, thank you very much. This is, always, we don't have enough time, we could be here till tomorrow morning. But again, I thank you for the great work you're doing for saving lives and continue to apply early home-based strategy. And somebody who owns a hospital who is totally sold on this idea, that says a lot. So what you've contributed here will resonate far and wide. So thanks again, Jermaine. We'll bring you back at another time.
Thanks, man. My pleasure. Have a good night.
You too. All right, stick around if you can.
Sure.
Tony K, can we check if one of our special, we want to reach out to the Lions of Kingston that they're also with us, and also reach out to Deputy Matron Patsy Henry if she's here. We'd just like to have a few words from her. Tony K, can you see if you can find the Nurse Association of Jamaica, Nurse Patsy Henry?
She's been asked to unmute herself.
Right, yes.
Nurse Manager Patsy Henry, you've been asked to unmute. It should have popped up on your screen.
Welcome.
Good evening. I joined with the intention of getting information because I wasn't sure what the whole webinar was about. I have listened. I have learned. I came on late, so I'm not able to articulate on the earlier presentations, but I'm listening and I'm learning and being educated and enjoying so far. I wasn't really prepared to make an intervention, but it's really interesting, the testimonials and the information that is given. And I just hope that we will be able to get over and past this scourge of the pandemic pretty soon. Doctor just said that it is going to go away, and I'm just hoping that it goes sooner than later. And with the recommendations that have been given so far, I realize that rest is one of the big ones, and that is something that a lot of us are not able to do easily. So if we are able to rest and relax, I'm not sure how easy it is for persons to relax when they're having the challenges, but it is good information, and I'm looking forward to hearing more of what you have to share. Thank you.
Yes, Patsy, Deputy Matron, I just want to go on record, and I'm sure everybody in this meeting would join with me in extending our solidarity, support, and condolences as well, because the nursing fraternity has taken a huge blow, several blows. And we believe that perhaps with this early home-based strategy, it could also provide an answer for the future. And it's really difficult for us as members of the health field to believe that there are nurses who may not have a doctor's number. And we want to make it absolutely clear that we, as a part of this forum and conference, we make our numbers available for every single nurse up and down the length of Jamaica, that they can see their symptoms and come early. They can see the headache for a week and not wait for a week, but come after 1 or 2 days. and that they can be empowered so that we can get them early. And if, as you will hear in a short while, you'll hear from nurses who are being treated at home, who are being treated successfully at home because they have been engaged early. So thank you very much for being here and continue to be here. And we know that this message would resonate in the correct way. So thanks again for your contribution and your leadership to the nursing profession at this time. So Tony K, let's see if
I'm here.
Okay. Okay. Shall we now move?
Just before you go, thank you very much. And I'm really looking forward to the testimonials. And what I really believe is important is identifying the symptoms, identifying the challenges early, because a lot of times persons feel just mildly unwell and do not acknowledge that they're having challenges. And sometimes we take a wait and see approach, and that is a challenge that we have. So I'm hoping that persons will hear that once you identify that you have a challenge, early intervention is one of the ways that we can help to keep the morbidity and mortality rates down. Thank you very much for your sentiments.
And to add to that, we recognize a particular champion case of a 104-year-old nurse, a retired nurse trained at KPH, a doctor's mother who developed COVID, but she was early detected. And though the thought was that she would not survive, she's alive today because we treated her early, because we concentrated the care on her. So we recognize every nurse's struggle to provide health for others, but we want them to tell us. It is not the time to keep it, oh, I'm not feeling well, and keep it to yourself. Share, talk about it. I had COVID, destigmatize it. Let us be our brothers and sisters keeper. And again, we reach out to the nursing profession, and we are in 100% solidarity with you. Thanks, Matron. Thanks for the great leadership that you're doing. And we will continue to get through this together and better. Thank you. Nurse Tony K, let's move into the testimonials now. Can we have perhaps Tamara or Miss Hewitt up first? Can we find Tamara?
Sure. Do we know Tamara's last name?
Hewitt, I think Hewitt, or Natasha perhaps, and Jervine. Jervine is here as well.
All right, so here's what we'll do. Because we have quite a few testimonials, the truth of the matter is that there are many people that even if they think they may be contracting COVID, you're almost embarrassed to share it. You're almost embarrassed to let people know that you have COVID, had COVID, might have COVID. And so what we want you to do is hear from people who have had COVID and hear their experience, how they overcame it. And so what I'm going to do, because we have so many people here, I'm actually going to ask the few of our persons giving testimonials to just raise your hand so that we will be able to find you easily. So I have a nurse, Jervine. Let me know if Jervine Richards, if you're on, just raise your hand for me. As well as Akeem Adamson, if you're on, just raise your hand for me so that it's easier for us to find you. As well as Nigel Squire. We'll start off with those three persons. So we get a lady, we get two gentlemen. Let's see if we have those persons still on with us. So.
Raina Spence is here. We could take Raina Spence.
Oh, I'm not seeing. Okay, all right. Let's go with Raina Spence. Raina Spence, you're there? Oh, yes, I see your hand up now. Let's ask you to unmute.
Yes, that's Raina.
Raina, can you hear me?
Welcome, Raina. Oh, let's ask her to unmute.
She's been asked.
That's that.
She's been asked to unmute.
Reina?
Well, Doc, you tell me. We have persons whose hands are up who were not previously specified that they would be giving testimonials. So you advise.
Denise Hebert. Denise Hebert is here. We could take her.
Is she on? Let's see, she's unmuted.
We're asking you to unmute Denise Hebert.
So while we are doing the unmuting, we just wanted again to thank everybody for logging in. Thank you so much to Medical Strategies for sponsoring. Thank you so much to Dr. Hunter, who has been the moderator for this evening, as well as really co-chairing this entire drive to give us this information. We will be having a question and answer section after these testimonials. So if at any point there were some questions that popped up, please keep them in mind, so that you are able to ask the questions at the end of the testimonial section, and then we'll be done. So let's see if anybody has been able to.
We have Nurse Andrea on. So she is going to share her COVID journey with us. Nurse Andrea?
Hello.
Hi, okay, great. There you are. Welcome. Let us hear your journey.
Hi, good evening, everyone. It is a pleasure to share this evening. I am a registered nurse who works on the general ward, surgical and medical, as well as accident and emergency unit. And oftentimes I come in contact with suspected COVID cases as well as positive patients. For me, I started to have malady, which is something I'm not used to, as well as fever. I woke up early one morning feeling chills. I was about to get warm, and one man said I should check my temperature, which I did. I also have access to an oxygen, a pulse oximeter. So I have been monitoring my oxygen saturation. Also, my mom in the house was having some symptoms similar to when she's affected with sinusitis, but in a time like this, I tell persons that we take nothing for granted. Some things seem like something you might be used to. I remember treating a patient once with asthma, and her result came back positive. So I decided not to take anything lightly. So I started to monitor my mother's temperature. She was having a fever, 99.4, going up to 100. Started taking Panadol, kept in touch with Dr. Hunter, of course, hearing about the early home-based treatment. And he was really on the ball with us. Sometimes I wonder how he does it, keeping in touch with us, and started mommy on Panadol, monitor her oxygen saturation, as well as her temperature. Sometimes she even had to do tepid sponging. We do the steaming as well as some of the natural remedies, turmeric, ginger, garlic as well, drinking that. And things have been going well. Mommy's about day 5 now. Oxygen levels above 95 and no fever at this point, no progression of symptoms. She practices proning as well to cough and to get anything off the chest. For me, I've had sore throat as well, practicing oral hygiene, as well as gargling with lime, drinking lime water, etc. Hydration also is very important.
Excellent. So thank you so much for that, Irvine. That's a powerful share. Again, having a pulse oximeter, being in touch with your symptoms. We heard from Deputy the NHA President telling us, let us be more responsive to our symptoms and let us report early. So how important do you think that's been for you so far in this journey, Jervine? She gone?
Yeah, I believe she was muted
Okay.
again because you
Oh,
were.
she was muted again. Okay, no problem. All right, can we go on to Tamara? Can we find Tamara? Tamara is ready now.
So as Nathan finds tomorrow, since we have quite a few people who have had some, experience, what I'm going to do is just give a
Tamara?
general 2
Oh, yeah,
minutes.
she's good. Tamara
Hello,
is here.
good night.
Yes,
Hello,
if
good
you
night,
could
Tamara.
Dr. Doc, just give me 1 second so that
Oh,
because we have so many people who are going to be sharing, just to give people a guideline, if you could state your name, maybe if you wish what it is that you do or, what industry you're working or whatever, and just as quickly as possible, give us your experience within a 2-minute time frame so we can get through as many of our testimonials as possible. So tomorrow, hand over to you. Thank you.
Hello, good night to everyone.
Good night, Tamara.
I'm Tamara. I'm a registered nurse. I just one day, just one day, a little week, I wanted to go and take the vaccine. And, like something said to me, just do a random test. I'm asthmatic as well. Did the test, was working quite fine and everything, came back positive. I am presently on home quarantine. I've been doing my steaming, deep breathing exercises. I have been drinking the turmeric with ginger tea as well. And of course, I have to keep my my inhalers, which is my Ventolin and my Atrovent ready. I've been doing well, thank God so far. I was speaking to the infection control nurse, and she said it was a good thing that I did the test, because if I didn't do the test and went and got the vaccine, it would have given me more complications. So I just have to thank God for that. I'm just praying that we all get through this wave that's going on. We just have to trust in God. And as I said, early home treatment is very, very, very important, extremely important. I cannot agree with Dr. Hunter more, and as with the other rest of persons who have been talking. Okay.
Thanks, Tamara. We know that you're currently going through the COVID journey, that you're active, and the fact that through early intervention, you're able to share with us. So we're actually witnessing live and in living color what someone actually is going through now with COVID and how you are able to cope. And so I feel a little bit bad for bringing you here, but just to emphasize the point that early treatment can allow you to function at a much better level rather than waiting for that headache. And I think the point you made about the vaccine is very relevant. We 100% support and endorse the vaccine, but we also abide by the WHO guideline, which has made it very clear that you should not take the vaccine when you actually have COVID. And so we need to take the infectious disease nurse's opinion that she gave to you on board, that we should try and get tested before, maybe tested once and twice before taking the vaccine, especially with a positivity rate of 40 to 50%. So thanks again, Tamara. Thanks for sharing with us and adding to the substance of our meeting in a very significant way. And we know we will be with you. We are following your journey. You know that you have my contact 24/7. And if there's any difficulty, you will let us know. Thanks again for being with us tonight. Moderator, Tony K, shall we go to?
We could take Dr. Janelle Dixon. She has a hand raised.
Yes. Yeah, we're going to get Janelle.
Hi, night again, everyone. Quick point. Registered nurse Andrea had mentioned she rinses with lime water. So when doing so, if anybody else should try that, bear in mind that the lime is very acidic and can actually erode the tooth enamel. So you can have cavities occurring or the teeth structure itself being weakened. So if you're going to do something like that or similar, ensure that you rinse out afterwards with water, or even to tip a little, like a teaspoon of baking soda in the water, just to neutralize the acid. That's all.
Thanks, Janelle. Thank you for that. That is always excellent to have you here to balance it, because natural products help, but we must do it in moderation and with balance. So thanks again. Let's remember to neutralize the acid. Tony K, shall we bring some? Is there a Dr. Denise in the house? Can we find Dr. Denise and her COVID journey? Gonna ask Denise to unmute. Denise? Denise, can you unmute? Let's see.
Asking her to unmute, but she's not responding. Maybe we could take Raina Spencer.
Lovely, yes. Shall we? Raina is not responding either. Can we go
No,
on
not responding.
to Nigel? Shall we try and find Nigel? Or
Nigel, if you're here with us, you could just give us a raised hand. Nigel.
no, Nigel. Or shall we try Donovan Mitchell or Michaelia?
All right, there were several Michaelia, so we're not sure. So Michaelia, if you're there, give us a raised hand. Donovan Mitchell, if you're there, give us a raised hand. Not seeing them, Doc.
All right, shall we try Julie Taylor and Sarah James Vaughn? Let's say Julie Taylor.
All right, Julie's here.
Oh, I got a message that Michaelia is trying to unmute, but she's not able to unmute.
Can we find out which device she has joined with? That will help us.
Okay, I will. The same
Hey,
thing.
Julie, go ahead.
Good night, everyone. I'm thanking Dr. Hunter for giving me this opportunity to share. I am Julie Taylor, yes. I'm 51 years old. I'm a manufacturer. And this program is very awesome. So I too wanted to take the vaccine, but I had a little sticking in my chest and I really had to get it checked out. I checked with a friend and she said it's happening. So I told her I need to take a test. Anyway, about a few days after, I got this terrible headache. I never had headaches over 4 years. I'm not sick. I'm a healthy person, how should I say. I work out 3 to 5 times per week. I've changed my diet. I've lost 101 pounds. I am the health guru. Take my product, my turmeric, my everything. So when the headache came, I said something is wrong. My whole body was weak. So this was 2 weeks Sunday. I'm in my 10th day. I'm my 10th day of quarantine. My little room here is where I do everything. I even have my hot water kettle. So on the 3rd day, after I was tested positive, my husband is also here. He's in the next room, but I are quarantined here, so he is negative. So the minute I realized the headache and the body chill, I started to wear my mask and I started to quarantine. And the next day I did the test. 3rd day after, I had my chest feel like it was caving in. And I remember I got a video from somebody and I watched it. And I read everything that person said. And so I'm happy I did watch it the night before. And one Dr. Ascott was on, I remember her name. She was saying when her patients were feeling ill in the night, she would tell them to get a bottle. She said, everybody have a soda bottle. She just blow in it like this. And that's what I grabbed the bottle and I asked for a straw and I blew in the bottle, and I felt a little breeze. And then I text Dr. Hunter because his number, thank you, Dr. Hunter, so much. I text him and he said to me, steam, 30 minutes. I said, I steamed today already, but that was about 3 minutes. He said, steam, steam, steam. And I got up, I brushed my teeth and do my stuff. And I got some water and I pour it in a container. I did not have any mental crystal. I had some Vicks for over years. And I put it in the water and I steamed. I steamed. And when I finished steaming, I used some hot water in between. In between steaming and hot water in between of some. When I'm finished, I'm wet. Steaming saved my life that night. If you can see my table, I have everything here. I have cayenne pepper, I have everything here works. Eucalyptus oil, I can put it in the water as well. I am in 10 days, so I'm feeling my best days now. Best days now. The ginger, as I spoke about earlier, the lemon is very, very important. Your onion, so we had lemon, onion, and ginger. Also, I use that to steam as well. And another great home remedy is nutmeg, grate it right out, and a bit of ginger and boil it right down. So that was also some of my heat fermentation drink when I'm doing the steaming.
Many, many thanks. And may you continue to flourish and thrive and have a wonderful career and life together with your fiance.
Thank you so much. Thank you everyone for listening. Enjoy the rest of your night.
Continue to listen. Thank you. Can we have Sarah James? I think Sarah James has a journey.
Hi, how are you? Good night, everybody. So I am just speaking on behalf of my parents because I'm not sure if my mom was able to make it on tonight. Dr. Hunter has been supporting them through their COVID journey, and I really just want to. I sent him a text message. I think I sent you a text message yesterday, just saying how grateful I am because I'm actually in Canada, and I'm an only child, and knowing that my parents were sick and I was so far away and not a lot of people around them to help, I was just really grateful. So when my mom finally told me, because she didn't tell me right away that daddy was not feeling well. By the time I found out and I spoke to him, I said, you definitely need to see a doctor. And my mom had at that point started getting symptoms. And because there was a tropical storm that week, they couldn't move for 2 days. So by the time the couple of days passed and they went to a doctor, they got seen, they got tested. It was positive. But what they got from that particular doctor, I just wasn't satisfied with. And I also wasn't satisfied based on how my dad was sounding. I was very, very concerned. So I was able to get in touch with another holistic practitioner. I'm a holistic practitioner here in Canada. I was able to get in contact with someone in Jamaica, and she made her way down to my parents on one of the lockdown days. I was so grateful because she had been in contact with Dr. Hunter by that point, and together they were starting to work with my dad, who was considerably weaker. And all the things that Dr. Hunter mentioned, steaming, because my dad's O2 saturation was low. If he was here, he would have been in ICU guaranteed. Because I currently have another relative who is on a ventilator right now, and his oxygen saturation is better than my dad's was at one point. So I know that the steaming actually really worked from in the 70s into the 90s. After half an hour of steaming, my parents got all of the things that Dr. Hunter mentioned: ivermectin, antibiotics. I was really impressed as a holistic practitioner, as a holistic nutritionist, all of the vitamins that were on there, because that's something that I always kind of emphasize: therapeutic dosing of vitamin C, always vitamin D3, even the zinc as well. And just reminding everyone that sugar depletes zinc in the body. So having anti-inflammatory diet is really critical. And just going back to my parents, my dad was a lot weaker because he wasn't eating and he's quite a thin man. I was really concerned. But the thing that really helped me, because at one point I was just like, what can I do? Do they need to go to the hospital? But Dr. Hunter was so reassuring. And what I realized that COVID is very much mental as well. So if you're very fearful, that's going to actually affect the outcome. And my mom told me how there was one point where my dad's O2 was in the high 80s. And after talking to Dr. Hunt on the phone, it went up to 96. So I think that reassurance is also very helpful. It helps to just alleviate the fear, remind you to connect with your breath, taking those deep breaths. And, my parents are doing really well now. My dad is watching cricket again and eating, and my mom is doing all the things she always does. They sound really great. So I'm very grateful, because I know if they were here, it would have been a different story. So very grateful to Dr. Hunter and all the doctors that spoke this evening.
Sarah, thank you. Thank you for this contribution from Toronto. I mean, I remember spending many winters in United Kingdom, and I often worried what would happen to my parents if they became unwell. And so I get it. It's important for the diaspora to know that their loved ones, that they're in capable hands, that they can rely on the confidence and the competence of those locally based. We want people to become COVID champions, not just in Jamaica, but everywhere in the world. We want you to be able to challenge the guidelines and remake the guidelines and to reshape them. Because if someone in the 80s can do well at home, then perhaps we don't need to pressure ICUs and we don't need to rely on so much oxygen in the management. And I recognize that the Jamaican approach over the weekend, that their levels for giving oxygen in the hospital patients is no longer 95%. They brought it down to 92%. Of course, for us in the early home-based model, our oxygen level trigger is actually more than that based on our, less than that based on our experiential learning. We will trigger oxygen perhaps at a low 80s, high 70s. But again, oxygen can be delivered at home. And if we continue steaming, we can quickly get them off oxygen. I never went on oxygen, personally speaking, even though my sats were in the 70s, but I didn't feel short of breath. I remained calm. And it's important to feel that sense, to maintain that sense of calm, because just being panicked increases your oxygen demand. So Sarah, thank you very much for that powerful contribution. And we will continue to look after your parents here in Jamaica whilst you do amazing things for us in the diaspora. And we want to recognize the diaspora, for they are the main contributors to the Jamaican economy. It's our #1 earner for the Jamaican economy, the diaspora. So we again salute the diaspora. And in any way that we can help, we are here to help. And we hope that as winter approaches, that the experiences will not be as severe. So thanks again, Sarah. Tony K.
Thank you.
Okay. Tony K, can we get more, a few more testimonials?
Faithlin, it's Faithlin handling this section. So Faithlin,
Thanks, Faithlin. Yes, yes,
All
thank
right, AP can unmute now and go right ahead. AP?
Good evening, everybody.
Good evening.
Yes, I think I may be speaking out of turn. I actually have a question and not a testimonial. So do I wait until afterwards?
Absolutely. We want
Okay,
to just
then.
get all the testimonials, because I don't want people to just hear from the doctors and the medical professionals. We want you to hear from the people who went through the journey. Of course, several doctors like myself, like Dr. Jermaine Spencer, like Dr. Leroy Heyman actually had COVID. So we are both patients as well as professionals. But at this moment, we just want to complete the testimonials from the professionals. Is there a Nigel in the house? Can we get Nigel to unmute and identify themselves? And if is there Dr. Hibbert? A Dr. Hibbert in the house? We want to hear from a doctor who is actually going through can you just raise your hands? Can we identify Dr. Hibbert?
I am seeing Denise Hibbert, and I'm asking her to unmute.
Right, yeah.
She's not responding. Denise Hibbert. Still not responding.
Okay, can we try and find, did you remember the list that we sent you?
To be reminded, everyone, while Doc is waiting for the other several testimonials, remember that we are having the question and answer section. So if you are having any questions, pressing questions that you'd love to have asked, keep them top of mind, and we are going to allow for you to raise your hand and ask a question after this section. So, you know, Dr. Hunter, let us know when we've had enough testimonials so we can get into the question and answer section, and then we'll go right into that and then close out then. So if you have questions, keep them, then we'll be right with them.
Right. And just want to get Dr. Hibbert because she's based in Westmoreland and we know Westmoreland is going through a bit of a difficulty now. And for her to apply the early home-based model in Westmoreland, it's something that we think it's worth to hear how that is going. So just bear with me a second. Let's see. Okay, I'm not getting through to her. I think is there. No, I think she may be attending. She probably will probably just move on to the Q&A now because I don't think there's any other testimonials that's there right now. We've gone about 7. How many testimonials have we? Or 8? Faithlin?
Wasn't keeping count, but Doc, I wouldn't be surprised if we passed 7.
Right. Okay. All right. Well, let's go into the Q&A now because we want to wrap it around probably no later than 10:45 because and just to say that we'll be on Smile Jamaica tomorrow morning on the health report speaking about early home-based treatment. We commend it to everyone that you all become COVID champions, COVID enabled. You saw in my presentation the plugs and mucus and the sputum that's plugging our airway. And we need to get that out using early home-based methods, particularly steaming and hydration. Very, very important. So without further ado, let us go into the Q&A. I think you have to put up with me for tonight. My other COVID champion doctors, they I think they may have retired. Not sure if Dr. Spencer is still around. Dr. Spent Germaine. Let's see. All right, well, we go into the Q&A now. I'll give about 35 minutes of Q&A. Okay, Faithlin, over to you.
Michael Scott, go right ahead.
Hello, good night.
Good night. Just identify yourself, who you are, where you're from.
My name is Lidon Wilson.
Hey, sir.
Yes, and I've been here, man. I've been listening to the program. My question, right, is the strategies that you spoke about, you know, the home remedies and all of that, right?
No, not remedies. Treatment.
Treatment. Oh, it's treatments.
Yeah,
what you do? Can it prevent COVID or it treat COVID? What it does?
You have both. There's a particular drug called ivermectin that is for exposure prophylaxis. Say, for instance, you're caring for someone at home in this early home-based model, that the only way it works is if somebody who is fit and able at home to look after you. So you have the risk of someone who has COVID transferring it to someone else in the home. So by using ivermectin, that's one possible way to reduce that. But also, we're talking about wearing a mask, oral hygiene, trying to limit the COVID patient within a certain aspect of the home. In terms of COVID early treatment, that's a main thrust, to treat people early. We recognize that the virus is very tiny, Mr. Wilson, very, very tiny. And that is hard to prevent the progression of that virus through society. There's community spread. So within that, we recognize that people will become ill. The question is, what do you do about them now when they become ill? How do you treat them? Do you let them stay at home and watch and wait for 2 weeks? Or do you treat them like Raina after a day or two, even with a negative COVID test? We submit to you that the fundamentals of medicine must be respected. The fundamentals of medicine goes like this. It is always better to treat a condition early. Do not wait until it's late. As a man, Mr. Wilson, things like prostate cancer, you want to detect that early. COVID is no different. If we can treat it early, we prevent the progression to hospitalization and death. And we have seen that time and time again. And my personal repertoire, which is over 300 COVID cases now, not one has died with early home-based treatment. And that needs to be compelled and commended, not just to all the COVID champions tonight, but throughout Jamaica, and we dare say the diaspora, the Caribbean. We know there are people from the Caribbean that are listening, but to the world as well. Early treatment works. Early treatment matters. Next question. Is that okay, Mr. Wilson? Yeah. Okay.
Right. We have L. Davis next in line.
Okay, good evening, everyone. Thank you for your presentation and your invitation. Now, I took note, Doc, that I think one of the person who shared your testimonial, and you would have said it before, that if you have COVID, you should not take the vaccine. But I'm here wondering, is it that the persons who have gone so far for vaccine, they are a part of the procedures that you have to be tested to be clear first before it is administered? Because some persons may not know what is their status. And I'm told that if you take it and you already have it, it could have problems. Am I correct?
That is correct. The WHO says that we ourselves, based on local experiential learning, we ourselves recognize that if you take the vaccine and have COVID, you have two sources of inflammation in your body, and you get something called the cytokine storm. There is a very prominent media personality who took the vaccine live on Facebook and sadly is no longer with us. You must not take the vaccine and have active COVID disease. This is absolutely, there is no debate there. It is a settled matter. Now, the question is, how do you treat it when half the population has COVID and the other half does not? And if you vaccinate, how do you ensure that you do not have COVID? So it's a very difficult decision. So I think it comes down to individual responsibility, that you have to take responsibility for your health. We heard from Nurse Tamara earlier, who on the advice of an infectious disease nurse, that she actually took the COVID test and found out that she was positive and then took herself out of the vaccination line. We also, and is doing fairly well now under my care with COVID. We also have heard from the Council Raina Spence, who had 3 negative COVID tests and on the 4th test tested positive. I'd like to take Dr. Heyman's experientially driven approach, which is to take a COVID test now and to take one 7 days later. And if both of them are negative, then perhaps you can proceed. But it comes down to individual responsibility, because at this time, the government is not providing free COVID tests for Jamaica. So I hope that's answered your question.
Yes, thank you. I'm not finished, Doc. Another part of that question is, if you have heard a few of the doctors and others would have had the virus, if you have had it already, is there any need then for you to take the vaccination? Wouldn't your body build up natural immunity?
Okay, let me just ask quickly. Well, let me just say that, yes, you definitely get, when you take the whole virus, not only is your B cell stimulated, but also your T cell, your entire immune system becomes aware of this foreign agent, not only about the spike proteins, but the whole virus. And studies have shown clearly that those who have gotten COVID are very much so protected up to a certain point. In fact, something called convalescent plasma, the part of the blood of those who got infected, is actually taken out of your body and used to treat those who are very, very sick with COVID. That principle is not applied to somebody who is vaccinated. That I'm yet to see any study that takes the blood of a vaccinated person to give to a person that is sick with COVID. It just, you don't get enough antibodies as you get when you have the full disease. So when you have the full disease, you can wait up to 6 months, retest your antibody levels. And if your antibody levels fall, then like myself, I'm watching my antibody levels because it's not 6 months as yet. But if the antibody levels fall, then you can proceed and take what vaccine is available at that time. Okay, so we'll have to move on to the next question.
Thank you so much.
You're welcome.
Thank you.
Thank you.
Yes, I'm not asking another question. All I would want to do, if I could get the contact information, given that having listened to everything.
Just watch this video and you'll get the contact information.
Oh, thank you very much.
All right. Next question.
Okay, good evening again, and I thank you all very much for sharing so far. My question though is because I'm trying to put together.
What's your name? Where are you from?
I'm sorry. My name is Paula, and I'm from Portmore.
Go ahead.
Yes, so I'm trying to put together my kit, so to speak, and so I intend to get an oximeter and the thermometer. So my question is, when I
Like we lost Pauline. I'm not seeing her. All right, until Pauline returns, I'm going to ask Radius to unmute and go ahead. Radius?
Hi, this is Radius from Jamaica, currently living in Florida. I wanted to ask, how would I speak to influence a doctor to give me an ivermectin prescription for COVID early treatment? They seem to be hesitant, and even the FDA, when you look online, there's a lot of talk suggesting that is no proof that it's of good use. And,
well, let me just answer you quickly. Well, this COVID has brought to bear or brought to the forefront, in some regards, what's called medical tourism. So there are people who are flying to United States of America to get the mRNA vaccines because they are thought to be better and superior. So you have a certain traffic in that direction. But you also have people who are coming out of America to get ivermectin. It's kind of strange to fly away, but I would think that there are doctors in America who would prescribe ivermectin, but you won't have a problem finding physicians in Jamaica that would make that available. That would not be a difficulty radius. So come to Jamaica and you'll get it done.
Okay, thanks. The second part very quickly is a doctor spoke earlier. I might have heard wrong, but recommending the vaccine, the COVID vaccine for pregnant women, but I'm not sure how much data was researched, and we have to be careful because I know of a case, and I've read of many cases where young pregnant women, meaning not young in age, but young in pregnancy, have a miscarriage and bled out. So I wanted that to be revisited if we're not sure if it would be good to recommend.
I'm not an obstetrician, but what I can tell you is this, that many pregnant ladies, when they get COVID, they get it bad. So it's about balancing risk. The risk of having COVID in pregnancy versus the risk of vaccinated in pregnancy. It's not at the state of mandation where of making it mandatory, and Dr. Spence did not say mandatory. He's just saying recommending based on what he is seeing happening to his pregnant ladies getting COVID. So with COVID, you always have to balance the disease and the treatment and see which one is worse. Is the disease worse, which in pregnancy it is, or is the vaccine worse, which in the kids, the vaccination actually depends on which vaccine, like the AstraZeneca vaccine, must not be given to children because the benefits are far less in children than the risk for the vaccine. I'm not an obstetrician and gynecologist. Dr. Spencer or the like, we have to follow their guidance. So for Dr. Spencer to recommend it, not mandate it, but recommend it, I think we can't totally ignore it. Okay, next question. Thank you.
All right. Colleen? Colleen?
Good night. Good night. My question is, if for the vaccinated persons, if they should get COVID, should they seek treatment, and how many such persons you have treated?
Thank you. In fact, I think Damien should have been coming on tonight. Several people, unfortunately, have now gotten COVID and the vaccine. They have gotten the vaccine, say, 2 weeks ago or 3 weeks ago. And sadly, we have even had some fully vaccinated deaths recently. But again, it's a balance. We always recommend early home-based treatment. And to answer your question categorically, that early home-based treatment is not only for the unvaccinated, it's not only for the partially vaccinated, but it's also for the fully vaccinated and those who are fully vaccinated with COVID. So the early home-based treatment is absolutely vital, especially in those who are fully vaccinated and have COVID. And we recognize by treating them early, hitting them hard, going really hard, then we can actually still prevent hospitalization and death in persons who are fully vaccinated and have COVID. So I've had several patients now. Next question.
Okay, Doc, you mentioned Damien just a while ago. Can I get his surname, please?
I think it's Franklin, Damien Franklin.
Okay, all right. I'll check to see if you.
We probably should just go on to the next question whilst you check. Is a KW who has, I can ask her, KW?
Okay. Yes, good evening. Hi, how are you doing?
What's your name?
Dr. Catherine Brown Williams.
Oh, hi, Dr. Brown.
Hi,
Thank you.
how are you?
Always a pleasure to have you.
I
And
couldn't listen all the time, but I was able to listen sometime for some
but
of
I
it.
know you're a COVID champion and you're saving lives now, without any doubt.
Thank you for that. Thank you for that hope and trust and encouragement.
Confident.
I'm asking a question related to what I know is a constant grinding problem in this country, COVID or no COVID, which is finances. And I just want to know if there's any lobby that will be made, maybe by this group or another group, to find a way to make the things that are needed in COVID more affordable. Pulse oximeters, thermometers, and let us say specific therapy that some doctors have been giving, such as ivermectin and others, to make it more affordable. And also to promote, if we really want it, a subsidy or reduction in cost of testing. Because I have many patients that I have, had to monitor from afar. They're not going for a test. They don't have the money. They're just not going. It's figured out. They're like, we're not going for a test. That's the end of the story, right? And we don't have that kind of money. And what are we going to do about the finances? That's my concern.
Well, at this time, we have a lot of COVID champions here, including yourself, and I'm glad that you asked that question. We have used every opportunity to speak, to encourage the government to find a way to not only help the 200,000 children that have been permanently harmed by the measures, but to help people who are actually suffering from COVID. And we ask the government to find a way to help people to better treat COVID and to treat it at home. We know that treatment at home early is multiple times cheaper than treatment in the ICU. Plus, the outcomes at home in our hands are 100%. So again, we join our voices with your voice to lobby and ask government, because we are sure there are people connected with government who have been in on this meeting, to look and find ways of making pulse oximeters more affordable, to make drugs like ivermectin more affordable. I, for myself, as my personal national response, have made my therapeutic services for COVID completely free of cost for the professional aspect. So 361-2686 is my number. I treat COVID every minute of the day, and I cannot rest. When we recognize that 21 people on one day drowned because oxygen was short, they had no oxygen, that we cannot rest easily on this. So we must come together and insist that government provides better support for the tackling COVID, that you cannot say that you don't help the population. We have to help us to get through this. And we recognize there's an IMF drawdown of over $500 million US. We want to see that going directly to help the people of Jamaica. So yes, thanks for asking that question. And we continue to ask government to be more responsible and to directly help us to treat COVID early at home and allow people to get through this better. Thank you.
Thank you.
Next question, Aura Burke is Caitlin.
Aura to unmute. Aura, okay, we're moving on to Lilith Scarlett. Lilith, you may unmute your mic now.
No.
All right,
yes, good night. I'm here. Thanks for this very, very informative presentation. Oh, Lilith Scarlett, I'm from Mandeville, Manchester.
Lovely having you.
Oh, thank you. I have been told about the use of the French thyme. I don't know if you know what that is. And that is very good in the treatment of colds. Could it be used? Do you have any information on it?
No, we'll have to get back to you about that. I'll ask Dr. Arlene Rose. Again, my number is 361-2686. I'll ask her if you WhatsApp me, and I'll pass it on to her. Thank you.
361. Say the number again, please.
361-2686. But this video is also played again on YouTube. Thank you.
Okay, thank you.
Thank you. Next question. We try to get in as many questions as possible.
Good evening. I'm Sharoni from Maypen.
Hi.
My question is, how long has a case of COVID prolonged? Because now that I've been listening, I came on about after 8, and since the 29th of July, I have been extremely fatigued and dizziness. That's the major one, was the extreme dizziness and mind fog.
I think it's gone for a year. It's what's called a long COVID. But with our early home-based treatment, like President Donald Trump got, he was able to return to work by the Monday. If we treat you early, we can avoid the long complications called long COVID. So,
because I have been having the same weakness and so, but then I was putting it off as fatigue. I went to the doctor, got other tests, but I never got a COVID test. And I actually got my first dose of Pfizer on the first day of
August?
No, the first blitz that they had when the Pfizer came.
Okay.
I was in that. But I am still, the fatigue is still there, the dizziness not so much. But now I am thinking if it could be prolonging for that period, now that you say it, and if I should definitely go and get tested.
Well, certainly you can go and get tested. We know that you can get COVID again. So I recommend that you go and get tested to make sure that you don't have COVID disease as well. And therefore then need specific treatment for that. But yeah, you should probably go and get tested. But long COVID is known, and it's not unique to coronavirus. We also saw it with the influenza virus in a form of chronic fatigue syndrome. And so we know it can last up to a year or more. Thank you. Next question. Can we go on?
Aura, your mic is open. You may go ahead now.
Okay, sorry about that. Things got lost on my phone a little. Calling from New York, and thank you for the wonderful presentations. I was calling in regards to the little bit about the ivermectin, because as the brother earlier said, bit of an issue over here in the States with that. So I was just wondering how much of it you all prescribed at the effective level to treat your patients.
Well, I took COVID as a patient, and but I just used 12 milligrams and 12 milligrams 2 days later, and then 12 milligrams once a week for 3 weeks. There are other protocols where people give like 24 milligrams for 5 days. That it varies according to the doctor. But for me personally, I usually perhaps a slightly more conservative approach. It is a problem in the United States because regulation is a bit different there. But I'd say come down, have a trip down. I mean, before the winter comes, come to Jamaica and, or the closest country that prescribes ivermectin.
Okay, and one other additional, do you also use hydrochloroquine?
HCQS, yes, absolutely. Long-standing drug, hydroxychloroquine, very, very decent drug. I used it, very nice drug.
And effective.
There's a lot of questions about cardiac side effects. Those are not borne out in long term. Hydroxychloroquine has been around for ages, just as long as ivermectin. It's used a lot in autoimmune conditions such as rheumatoid or lupus. It's not new. In terms of its effectiveness, again, with early home-based strategies, we have found it to be also helpful for those perhaps who are a bit more ill.
Okay, and last one, I know that our neighbors, the Cubans, have been also developed some vaccines. Have you all had any use of those available to you, and how have you found them if you have?
The simple answer is no. We await that happening, but no, we have not. So thanks. We will watch this space, and I'm sure it probably will happen, but as at the moment, no.
Okay, thank you so much.
You're welcome. Thanks for participating. Next
Okay,
question.
Freddie, you're next in line. Go ahead.
Yes, good night. I'm learning, and thanks for such a good presentation. I would like to know if it's possible for a vaccinated person to actually transmit the virus.
Absolutely, yes. Vaccinated, half vaccinated, unvaccinated. All three can transmit the virus. And if you've gotten COVID already, you can get it again.
All right. So the follow-up question to that then, can the country, Jamaica, really achieve herd immunity then?
Well, it's happening. With 50% positivity, herd immunity is happening right now.
Okay, but I'm just thinking if the vaccinated person can transmit the virus, then it might be temporary as soon as the vaccinated person virus, as soon as the vaccine is worn out of the person, then they can get the virus again.
No,
so
it
I don't
can happen.
understand.
It can happen. What it is that the vaccine is to prevent you from becoming very, very sick, not to stop you from passing on the virus. So you still have to wear your mask, social distance, sanitize, even if you're fully vaccinated, protected. So that's been very clear. There's nothing stopping a virus to fly from your nose to somebody else's nose, whether you're vaccinated or not, whether you've had COVID or not. The virus is not new. Coronavirus has been around for millennia, thousands and thousands of years. It always mutates. They've never been able to properly find a vaccine for it that will capture it, just like the flu virus has been around from 1930. So it's an ongoing challenge for the world. And we need to see what other strategies we can apply, such as early home-based treatment. This forum is not about vaccines, it's about early home-based treatment. Thanks very much.
Just to clear up in my mind though, could you just briefly explain what is herd immunity?
Herd immunity is where a mass of the population, usually it's set at 70%, have gotten the disease and therefore then have developed some immunity to the disease, such that the agent, the virus, that cannot pass on because it keeps going into people who have been immunized. We see that nicely with polio and many other immunization, other viral illnesses. But polio it's just that essential trigger to stop the propagation of the disease throughout the population. And 70% is usually accepted. But again, with coronavirus, today we saw in England, 207 people died, and they're barely coming out of summer. They're fully vaccinated. So it's a problem. It's a problem. Okay, let's move on. No more, we're really on early home-based treatment.
Asking Kimmy to unmute. Kimmy?
Hello, good night.
Good night, Kimmy.
So my name is thank you. My name is Kimberly and I'm calling from Westmoreland. I must say I'm finding the session extremely informative and I came on late to be honest, but based on what I've heard, the steaming with the mental crystal seems to play an important role in the early stages of recovery or fighting the virus, so to speak. But one of my questions, right? One of my questions, for example, my daughter, this summer, I found out that she has the sinuses, allergies, and I'm still trying to determine what is causing it because it's not a problem that she usually has. But what happened is the least of things.
But she has COVID. She has COVID until proven otherwise.
Okay, so well, that's news. All right, so one of the things, the least of things causes her turbinates to be swollen. For persons who don't know what turbinates are, it's like some swollen bumps in her nostrils. So the least of things, whether it's a perfume, whether it's a lotion or something, it causes it to get swollen. So I'm saying
get her tested.
We intend on doing that tomorrow because yesterday.
First thing, everybody must be tested.
Right. Yesterday we woke up with flu-like symptoms. So we decided to do that tomorrow. But what I'm saying is with her soul in turbinate, with the mental crystal, it's strong. So is there a substitute to that steaming?
Absolutely. No, no. Well, you have to steam, that's for sure. But you can use eucalyptus oil. You can use other herbs infused in the steam. But you have to steam. The virus dies or gets weak with the hot temperature. So steaming is very much a part of it.
Okay, and what type of herbs would you suggest?
Can you just WhatsApp message me? I don't want to say the wrong ones, but
Okay.
they were given earlier. I mean lemon and but again, WhatsApp message me 361-2686 and give your name and the special question. But go and get tested tomorrow first thing.
Will do.
All right, thank you. Next
You're
question.
welcome. Thanks.
Go ahead, Thema, you're unmuted.
Yeah, good evening, everyone. Thank you, Dr. Anja and team for this presentation, much needed. My question is, how detrimental is it for someone who has the virus unknowingly and take the vaccine?
Well, I don't think most people will necessarily die, but it significantly increases your chance of being in hospital or, something worse happening. So it's really important, if that happens, to step back and say, well, I need early home-based treatment, and let me get in touch with a doctor who treats early, and that's key.
Because I've read and I've seen other things where if folks are actually if they're positive and take the vaccine, it can be very detrimental. Okay,
the WHO says that.
Yeah. My other question is, you mentioned about testing for the antibody, because if you get a virus and your body builds the antibodies, right? Do you still need to, you mentioned something about the B cells and the T cells activating. Could you just repeat that piece again for me? I was just taking notes here. Because you also mentioned that if you have the vaccine, you cannot give the blood or be
okay.
Your body builds immune system. Your body automatically builds immune
There's something
system.
called convalescent plasma.
Right, a convalescent.
You take the blood, the fluid in the blood from someone who has survived the disease, especially in the earlier processes, earlier phases after recovery. You'll find that their antibody levels are so high. And if you can take those antibodies out and directly give it to somebody who is severely ill, that can help them to survive. The thing is, we do not do that with somebody who is vaccinated, that their antibody levels are generally not that high to be able to take away their antibodies and give it to somebody who is very severely ill. Only someone who has survived COVID can we apply that strategy.
Okay. All right,
okay.
thank
you.
Yeah,
Next
thank you.
Asking Ketra to unmute. Ketra?
And Ketra, right before you ask a question, as you unmute, just to remind everyone that this entire presentation has already been recorded and is playing on YouTube. The barcode that is on the flyer will carry you to the YouTube presentation of this. So anything that you missed, you can always go back and rewatch. Just remind
Thank you,
everybody.
Tony K. Thank you. Thank you. Been such an excellent host. Thank you.
Go ahead, Ketra.
Good evening, everyone. My question, I'm from Mandeville. My question is, I normally steam with tea tree oil, eucalyptus oil, and peppermint oil together. Is that a bit too strong?
No, just moderation, maybe a couple drops though. It's not burning you, so you just be in touch with how you feel.
Okay, thank you.
You're welcome. Next question.
Pauline Henry, go ahead.
Hi, good night, everyone.
Good night.
I am an anti-vaxxer. I don't want to take the vaccine. I have been practicing is it naturopathic medicine? Or treatment, rather?
Naturopathic, yeah.
Right. I'm doing my garlic, my turmeric, and the rest of it since last year. I consider myself fully immune based on that. I do steaming. I don't want to take the vaccine mainly because if I take it, I can still get sick, I can still pass it on.
Okay,
Why do I need to take it?
thank you. We're not having vaccine. This is about early home-based treatment. So we're
Right.
gonna leave that question for tonight.
Okay, thank you.
You're welcome.
All right. AP, your turn again.
Okay, good evening again. My name is Paula from Portmore. I just wanted to know, I intend to get the pulse oximeter and the thermometer. So at the point of purchase though, how do I know that before I take it home with me, the instruments are reading correctly? How can I be assured of that?
Just ask the pharmacist, whoever sells you, to prove that they are working. Just ask them who you buy it for, that they open it up and make sure that it works, and they'll tell you what numbers to look out for. You can also search it on the internet, but just do not leave the store before making sure that the device is working.
Okay, all right, thank you.
You're welcome. Next.
All right, device K4 1S.
Hi, good night. Just wanted to find out about basil in terms of for steaming or for using for tea. And my other question is in terms of washing out their nostril with warm salt water.
I don't think Dr. Rose is still around. Arlene, she would have been the perfect person. I think warm, anything warm that's mild and gentle. It sounds like they're okay for me. Basil and tea. I think that should be fine. But moderation and just be careful and observe yourself. You have to perhaps be guided by someone who is familiar with using those products.
Okay, no further question. KBW, go right ahead.
Hi, just coming back again, Dr. Brown, just asking if you can still post the YouTube link, because some of us can't use that barcode. Can you just post a YouTube link, please?
Okay, we post it.
You can post in the chat if you can, and
okay,
maybe. Yes,
I'll get it. I'll get it to you. Sure.
Thank you. Awesome.
Right. Thank you. Asking Cherie. Cherie, unmute, please. All right, not getting
Hi, good evening. I am Tracy. I'm a COVID patient, 14 days now. So I'm not having any breathing problems, but today I felt dizzy and weak. So I'm wondering what is that?
What were you treated with? Were you treated with steroids, dexamethasone, prednisone?
Well, I had antibiotics and vitamin C and D3 and Bicozin.
What about prednisone or dexamethasone? You weren't given any
I don't know
steroids?
about that. I don't know about that. No, I don't. I didn't get that.
You have a doctor that's been treating you?
Well, actually, I went to a private doctor. The
Yes.
doctor is not monitoring me. I'm the one who is actually doing the doctoring.
Oh dear. Well, again, we have made our service available. 361-2686 is on this video. You can listen back, look back, and you will see it available again. So if you buy the pulse oximeter and the thermometer, we can guide you forward from there. Thank you. Next question, probably just two more questions, and then we'll call it for the night. Remember, we are on Smile Jamaica TVJ tomorrow morning at 7:45 a.m. with Neville and Dahlia Harris speaking about early home-based treatment, and you can look out for that as well. So we'll sadly have to just take two more questions, and then we have to close for tonight.
We'll take Sandra.
Okay. Hi, good night. My name is Sandra and I'm calling from New York. I don't know if this is off topic completely, but I have a family member who actually contracted COVID. And later on, I found out that he went ahead to also take the vaccination. So how can he, and it was the mRNA, I think it might have been Pfizer. How does one, if possible, try to cleanse their bodies of, the mRNA, if it is at all possible? Because
No,
now
you can't cleanse your body from that's injected into. What you can do is build your immune system to best deal with the cytokine storm. They really need to be in touch with a doctor who knows how to treat COVID and intense COVID.
Okay, because he had the COVID earlier on in the year and, recovered, just stayed home and everything. But
okay,
then,
let's not know. Okay.
But then I think because of the strictness of this requirement for jobs and so on, many people are not able to practice, especially in the medical field, nurses and doctors who refuse to take the vaccine. So I think under
That's
pressure,
in
he went
America.
ahead. Yes, in New York I am living. He went ahead and took it under pressure to keep his job.
Tell
So
them to come
now,
to Jamaica. We need
okay.
doctors. We need nurses. Sadly, most Jamaicans do not have a doctor's number or a nurse's number, and we need to change that.
Okay, thank you.
You're welcome.
Wonderful presentation, by the way. Thanks.
Thank you. Thank you.
Okay, asking to Wayne to unmute. To Wayne.
Yes, good night, everyone. Great presentation, well received. I have a colleague, she's pregnant and she was diagnosed last week Tuesday with the COVID. She got some medications, started steaming, and her two boys that live with her actually caught it. But she was doing well. We got her oximeter, pulse oximeter. We continue to monitor, ask for her temperature and her pulse, and they're okay, stable so far. But she's still having this stuffiness. And tonight she called me to say that, you know, she's feeling a little pain in her chest and in her back. I prayed for her. I did pray for her over the phone and I tell her to be calm, relax, and after a while, she fell asleep. It's from after 8 and she's still asleep now. What would you advise us to do? We're very concerned about her. She's also pregnant.
Well, you have to monitor carefully. Continue to do what you're doing, supporting her. Again, be in touch with a doctor who is comfortable supporting COVID. That every doctor must give you their number if they're treating you for COVID, because deterioration is definitely a possibility. So we certainly advise you to speak to the doctor who would have treated her first to see if they're comfortable releasing the number. If not, then again, I've made my number available to you. Okay, can we have one more question from Michelle Scott from Sagicor? We haven't heard much from the insurance companies, so let's get Michelle's question, and that will be the final one for today. We'll have more, but Michelle, you get the last question.
Yay. Okay, so thanks, Dr. Hunter. Okay, so my question is, and we're talking about early home-based treatments, but how early is early? And that's my main concern. Right. So is it the first sneeze? Is it the fever? Is it the So you start treating it, and that will result in what? Not escalating.
That's correct. Remember, everybody who dies, everybody who is on a ventilator, they were very, very mild. They don't start sick severely from day one. They start up very mild, a little sneeze, a little itch, a little headache, a little tiredness. You got to pick it up. And in a pandemic, we want everybody to understand this word. It's called a working diagnosis, not one from a PCR or an antigen test, a working diagnosis. We heard from counsel today that she did 3 COVID tests and they were all negative. So we have to develop what's called a working diagnosis. That, for instance, if you have somebody who is COVID positive and you are exposed to them, we don't need you to have a positive COVID test if you have symptoms attributable to the COVID disease, such as sneeze, cough, runny nose, loss of taste, loss of smell, headaches, weakness, tiredness, muscle ache, diarrhea, nausea, vomiting. Those are all consistent with COVID. We start treating you early. Early treatment matters. Early treatment works. Very important, Michelle, to hear this and to work with that as a working diagnosis. Now, after you're better, you get what's called a therapeutic diagnosis. That is born out of born out of the fact that you have now responded to treatment. This confirms and consummates the diagnosis, because you would not have responded if it were not the right treatment.
So would you still have to take the test though?
No, I think what you'd have to do, well, you could or you couldn't, but what you should also do is to take the antibody test. Maybe a month later, you do an antibody test and see what your antibody levels are. But yes, you can generally do the antigen test before you go back to work.
And where do you do this test?
antigen test is done right across the length and breadth of Jamaica. It's done at Bay West Hospital Clinic. CEO Dr. Spencer came on earlier. It's done at the Winchester Medical Surgical Institute in Kingston. There are so many. You can Google it and you probably can hear micro labs, biomedical labs, central lab. You know, this is not a paid announcement. I'm just telling you where you can get the test done. But I think as a member of Sagicor, you know that, you know.
Yes, I know we can get it done, but I'm just saying it for the general public.
Sure.
person
Thank you for that. Well, we're gonna draw it to this session to a close. I'm gonna hand you back over to Tony K and Faithlin. That they have been absolutely brilliant. It's really a pleasure engaging with you, and we will continue to engage with you as far as humanly possible. And if I can save just one more life, then I will soldier on and I'll walk a little further until that life is saved. So we know early treatment works and it has saved many, many lives. You heard the testimonies today, and these are people that probably would have ended up in an ICU or even worse. So let's all be COVID champion. Let's all be COVID enabled. Let's all be COVID competent, and let us be our brothers' people. Thank you.
Thank you so much, Dr. Hunter. So, ladies and gentlemen, this brings us to an end. I leave you with just a few quick announcements / reminders. Number one, there is no shame in having COVID. If you think you may have COVID, we have reports of people thinking they may have COVID and they're ashamed, so they're not telling anybody, they're not going to the doctor, they don't want anybody to know. Rubbish. It's something that, as you can see, hundreds of thousands of people all over the world, if not millions, have contracted. There's nothing wrong with you if you get COVID. You now need to treat it. So that's number one. Number two, if you do have COVID or find that you have COVID, please quarantine. It has been brought to our attention that there are people who have COVID and it's not affecting them very badly. Maybe they're asymptomatic or they're just not presenting, very severe effects of it. And so they think, oh, well, this is not so bad. And they still go out and, spend time with their family or interacting with the people in their household. You never know what the person who receives that COVID from you, what the impact will be on them. So even if you feel like, well, this is not so bad, I don't understand. That doesn't matter. You're blessed, but that doesn't mean the person that you may pass it on to will be as blessed. So please ensure that you quarantine and still do the steaming, do the herbs, do the things that have been asked of you throughout this presentation. Last but not least, we have to, on behalf of Jamaica, I will do it for everybody on this Zoom, on behalf of the entire island, we thank from the bottom of our hearts the medical fraternity, all the doctors, all the nurses, all the people who work in the hospitals, even if not in a medical capacity. You guys have been holding it down for month after month after month, and it is with absolute joy that I give you your thanks and give you your roses, putting yourself at risk all the time. So on behalf of the hundreds of people on this Zoom and the thousands of people to watch the replay, thank you to every single one of you who has been giving so much of your time and energy and expertise to help us all. So blessings to all of you. Very, very quickly, we do have the replay. The replay link is in the chat. So if you came on late, or maybe you don't remember something that was said, go to the chat and copy the link that was posted, and it will carry you to Dr. Hunter's YouTube page, which is where this recording, as well as others having been done in the weeks prior to now, they're all there for you to review. Last but not least, it will be remiss of me to not say a huge thank you to people behind the scenes who have been doing a lot of work to ensure that this information was happening. So Faithlin Williams, big up yourself, Lorna Chin, all the speakers who gave up their time, thank you so much for giving us this information. And of course, thank you so much to Dr. Roger Hunter, who really helped, and Dr. Heyman, who really were instrumental in ensuring that these sessions happened so that we would get this information. And so I know that Dr. Hunter has been on the phone with people 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock in the morning, giving out his phone number, really checking in, checking back, and caring about these people who have this virus. And so Dr. Hunter, thank you for your tireless work. Thank you to Medical Strategies that has, played a huge part in ensuring that these sessions also took place. And so, ladies and gentlemen, with that, stay safe, stay well, stay healthy. And if for whatever reason you do contract COVID, stay calm and treat as early and as consistently as possible. Have a wonderful night, and hopefully we'll see you again healthily very, very soon. Thank you, Dr. Hunter.
Thank you. Thank you. Let's be COVID champions and COVID competence. Good night, everyone. Good night, and be safe. Be safe, be safe, and let us go.
Good night, and thank you.
Good night, Dr. Hunter and your team. God bless you.
Doctor, thanks much.
Thank you.
Thank you.
Thank you, guys.
Yes,
Well done.
Awesome.
Thank you all. Millions.
YouTube or the replay.
Night, Sister Caitlin.
Thank you, Dr. Hunter. God bless you.
Blessing.
Very awesome presentation.
Thank you.
Excellent presentation. Take care.
Go forth and tell. Go forth
Good
and
night
tell.
and thank you. God bless you.
Thanks. Excellent presentation.
God bless you. Keep you. Excellent presentation.
Wonderful, wonderful.
Have a good night. Big up, big up, big up.
Thank you. Thank you.
Doctor,
Safely.
the prone position is very important to Dr. Hunter. Dr. Hunter.
Dr. Hunter.
Good night. Good night. Good night, everyone.
Dr. Hunter, I
Good night.
wanted to mention rub using and I
Vicks
didn't
rub.
get a chance.
Yes, a lot of rub, Tiger Balm, Vicks, a lot of different ones. But we have to steam it into your lungs.
That's right.
And
Don't
in the
forget my
prone
vote,
position,
another.
Dr. Hunter, in the prone position
Yeah,
to the back. Yes.
Go and get your friendly doctors to vote for me for the MAJ president election.
And all of those hot stuff.
Will do.
You have to steam
Go
into
forth. I need an army of people. We invited the MAJ tonight, but unfortunately they were otherwise occupied. So the president.
You win already, Dr. Hunter.
Dr. Hunter,
So-
can you just repeat your number,
Yes,
please?
doctor.
Crown him. He's a
Save lives. You
I
need
won already.
Hey, Doc, you want to run for
Can you
to be
repeat your
Prime
number?
Minister, Doc, the first medical Prime Minister of the island?
Well, we almost got it. I think Dr. Ivan Lloyd was the first opposition leader in 1944. I think you never know. You don't know what the future will hold. That's not my ambition, though.
Well, I'll look out.
We're here
I'll
to
look out.
support the nation and the people here and overseas in the Caribbean.
Amen. Amen.
Dr. Hunter, can you please repeat your number?
361-2686. Let's rewatch the YouTube. They are 2686. Just watch YouTube again. Watch YouTube. You'll see it. Early home-based treatment YouTube. They're there. Like, share, and subscribe. Like, share, and subscribe.
Yes,
We need you to really give power to these videos so that they can get better search profiles when you search for them.
Just wanted to know also, Doctor, they were calling from Long Island, New York.
Oh, nice. Yes.
Yes. And just the prone position is a good position when people are, well, this is part of the protocol.
Yeah, definitely.
Yeah, definitely.
Yeah.
Prone position, yeah.
Everyone, remember that if you're sharing the link to this information session, just put a little note that we were hacked, you see? So when the people them see this things popping up on their screen, please don't let it look like it was a part of the session. Me I beg you to do. Just tell them that it was hacked, but the information is still good. All right?
Yes.
Can it be edited? Can it be edited?
It certainly will.
Can't we we should try and do that, Dr. Hunter, please.
It's gonna be edited. We know that from before.
Yes, those guys were very unreasonable. The Lord will forgive them as we forgive them. In Jesus' name.
Indeed, Sister Alonji. Thank you.
God
Thank
bless
you
you,
so
sir.
much.
God bless you so
God
much.
bless you and your
Appreciate
wonderful
you.
family. Continue
you,
to
bless you.
educate the nation. Thank you.
So we do. Thank you. Bless you.
God bless you.
A
Yes,
lack
sir.
of knowledge of people perish, man. Oh my
Stay
God.
blessed.
Thank you. Thank you.
Okay, Doc, your time to end the meeting.
God bless
Indeed.
you, sir.
So
God bless
bye,
you in
everyone.
abundance.
Become
Good
COVID
night,
champions.
everybody.
Go forth and save
Night,
lives.
everybody.
Thank you. Good night. Good night.
God bless
God
you.
bless you.
Good night.
Good night.
Bye-bye.